Okay. Shall I get started?
Yes.
Morning, everybody. Okay. Hungover? Yeah? All right. Day two. People are always a bit hungover in these sort of meetings. But anyway, welcome to Berlin, and welcome to the Humanitarian Congress. So this is the first session. So first of all, I want to thank you all for showing up this early. Now, this session is on reforming global health, balancing humanitarian urgency with long-term systemic change. Right? Just to frame the discussion a bit, it's ultimately about who wields the power, who reaps the profits, and who sets the priorities, right? So, and these are not new questions. So they were asked in Alma-Ata in 1978, when the international community made a commitment, radical at that time, and it was never really fully honored, that health was a fundamental human right, inseparable from an equitable international economic order. So health for all by the year 2000 was the promise. But what followed was structural adjustment, the dismantling of public systems, the imposition of user fees, and the systematic subordination of health to fiscal discipline. The vision of Alma-Ata was not overtaken by events, it was defeated by interests. Now, this defeat was not accidental, it was organized. Over the decades since decision-making power and financial control in global health have been progressively concentrated in high-income countries and in the hands of a few private actors, development finance institutions, pharmaceutical companies, insurance companies, new foundations, and now even hedge funds, whose accountability runs to shareholders and to donors, not to populations. Intellectual property rules designed ostensibly to reward innovation have in practice protected returns on investments above anything else. Now, trade agreements were structured to extend monopoly protections. And when challenged, the response was process, more platforms, more summits, more multi-stakeholder dialogues, forums that claim to govern global health while ensuring that the most who need to shape it were not even in the room. At the International AIDS Conference in Durban in July 2000, Dr. Peter Mugenyi, who's a Ugandan physician and HIV researcher, put it very precisely: where are the drugs? The drugs are where the disease is not. And where is the disease? The disease is where the drugs are not. That gap between where the burden falls and where the decisions are made, between where the profits accumulate and where the dying happens. It's not a coordination failure, it's a structural feature. It was true in 2000, and it's also true today. Now, Mariana Mazzucato and the WHO Council on the Economics of Health for All named the underlying inversion. The economy has been asked to determine what health can afford when the relationship must be the other way. The economy must be restructured to serve health. Right? Not health rationed to serve the economy. That this formulation still reads as radical nearly 50 years after Alma-Ata tells us something about the distance between the aspirations and the architecture that we have built in the last 47 years or so. The crisis we are now in is not simply one of privatization, it is one of financialization. The deeper reorientation of health systems towards generation of financial returns in which development finance institutions mandated to serve public goods have channeled resources into private intermediaries with limited accountability for health outcomes, and which debt service obligations have hollowed out the fiscal space of governments that might otherwise have built the systems the populations need. Uganda, just to take one example, spends 75 cents of every tax dollar on debt repayment in 2021. And the figures come down a little bit, but it's pretty much at that level, leaving almost nothing for health. Right? Joseph Stiglitz and the G20 Committee on Global Inequity have documented where this leads. Between 2000 and 2024, the richest 1% captured 41% of all new global wealth. Inequality, the committee concluded, is not a given, it's a policy choice. The ODA withdrawal now underway does not arrive into a neutral situation. It arrives as an accelerant to systems already made fragile by decades of these choices. So that's the point that I wanted to make, that we talk about cuts, but it doesn't happen in a vacuum. Now, the spaces where global health is discussed have not confronted this honestly. At Davos and at the World Health Summit in Berlin, civil society is assigned to the listener's position, if it makes into the room at all. We have all heard stories about people not even getting visas to attend these meetings. Hedge fund managers and pharmaceutical executives occupy the podium. Much of the funding comes from private sector, and these are forums hosted by the very governments that block a patent waiver while championing a pandemic treaty. Process has become a substitute for substance. Multi-stakeholderism has become a mechanism for private sector access to policymaking rather than democratic accountability. Now, these are not neutral venues. They reflect and reproduce the same power asymmetries this session is here to examine. So this is the context in which we meet today, not to manage decline, but to ask the harder question. What would a global health architecture look like if it began from the needs of populations in distress, rather than from the interests of the institutions that we have inherited? And I would include humanitarian agencies in this as well. What would it mean to take seriously, at its 50th anniversary, the claim of Alma-Ata that right to health is inseparable from equity and justice in the international economic order? So we're not short of diagnosis. We have been diagnosing this correctly. People have been talking about this for a long time. What has changed is that the concealment is gone. The vulnerability is now undeniable, not just in communities that humanitarians assist, but also in the richer societies that wield power in global health. So the question before the panel and before this room is whether that undeniability finally changes what we do, all of us. So to discuss these issues, we are joined by three very accomplished and thoughtful practitioners. Sandrine Chopin is General Coordinator for Doctors of the World, Médecins du Monde, in Mykolaiv in Ukraine, where she leads humanitarian health operations in one of the most active conflict zones in the world today, working with local partners to sustain care for communities under sustained attack. She brings to this panel the daily reality of what it means to deliver health in a system under siege, and the hard questions about what the international presence enables and what it forecloses. Now, Dr. Faiha Dafalla is joining us from New Haven, Connecticut, is a physician and public health specialist who until 2022 served as the Director of Health Planning at the Federal Ministry of Health in Sudan, where she led the development of National Health Sector Recovery and Reform Strategic Plan and managed Sudan's Gavi health system strengthening portfolio. She's now a postdoctoral associate at the Yale School of Public Health, and she brings to this panel the perspective of someone who has built national health systems from the inside and negotiated with the international actors who arrived to support them. And Dr. Hassan Saeed is a humanitarian medical professional with over a decade of experience in global health policy and emergency response, currently serving as intersectional humanitarian affairs manager with MSF in South Sudan, and is also the co-founder of Decolonize MSF. His work examines the colonial power structures embedded within humanitarian organizations and makes the case from the inside for a fundamental shift from a charity model to one grounded in local agency, equitable partnership, and the redistribution of decision-making power. So, excellent panelists, you will agree. So now let's move on to the session itself, and I'm going to start by a round of questions for each of the panelists. Okay. Shall we get started? So, drawing on your own experiences and a very quick, sort of one concrete observation and one concern. Now it's not the time for analysis, but just quick observations. How are the recent funding cuts and political shifts in global health affecting people in humanitarian settings today? And what worries you most? Maybe I start with Sandrine and go to Fala after that.
Thank you, Yuni. Good morning, everyone. I'm going to bring you straight into Somalia. What stays with me is not a story of failure after the disruption of funding. What stays with me is the patient work of Somali health professionals, community health workers, colleagues from community to community level to ministry level, health professionals who worked relentlessly for years. I spent 4 years there. I could see the work they were doing to try to integrate vertical program. We are talking here about the Gavi Global Fund, but also the nutrition program. All these programs were run separately. They had their own supply chain. They had their own human resources. It was daunting. Then they work relentlessly to try to integrate this into a reform with a package of health services, EPHS. And it moved, it worked. It was slow, it was difficult, but it was real. And it is exactly the kind of work we say Humanitarian Development Nexus is meant to do. But when the funding collapsed, that integration work is the first thing that went. By the end of 2025, UNICEF wrote in one of the reports that 113 nutrition sites had closed and more than 100 health facilities. It's gigantic at the scale of a country and knowing about the needs. Then the consequences, you see it already. We are already talking about drought and famine and disruption of health services, disruption of supply chain. And we start all over again. What a waste. Ukraine is very different. The system works.
We'll come to Ukraine in a minute.
Yeah.
Okay. So Somalia, I think what you painted a picture is quite stark. I mean, a lot of work has been suspended, and there are real consequences on the ground. Yeah?
And if I may compliment on Somalia, tremendous work.
Yeah.
Both by donors.
Yeah.
It was one place where you had emergency donors and development actors.
Yeah.
And you could see that the famous nexus was functioning.
You're right.
But it stopped too early.
Yeah.
Then we go back to square one.
Yeah. And so coming back to fire, you've sort of, from within the Ministry of Health, you probably have observations on how this has impacted your work and the system as a whole in Sudan.
Yes. Just drawing on that, Sudan entering its 4th year of the war in this April. And just looking back in 2025, which is the highest need was financially, where $4 billion was needed for humanitarian assistance, and only 6% have been funded by March, and half of that was U.S. application. So when I look at this, I just see that that cut of the fund has not just dipped in the resources, but I think of all the population, all the people who are affected. I look into the IDPs, the females, the displaced, the disabled population. And now there is returnees who are coming home where there is no actual infrastructure. So what worries me the most are the impact that we see at the community level, not only the national and the local level, or the impact on the organization, but on the community initiative that is built and funded by those initiatives. For example, we had what we call community kitchen, where they are providing meals for in the places where it is hard to reach. At the beginning, before the cut-off fund, there is about 1,400 community kitchen around Sudan in the conflict-affected area. And since the cut, 900 of these, more than half of them, have been stopped. So you can see now families who have those access those access.
Okay.
And I think what worries me most is how are we dealing with this? Which is what's really keeping me awake. How are we dealing with this precedent where the fund is cut suddenly, and how the people who are in the most need are already underfunded, and now they are having accessible impact.
Okay, so whatever little funds they have, they don't have it anymore, and so you're going deeper into precarity in Sudan. And maybe you can paint a picture from your last, where you were in South Sudan, and perhaps you can talk about your one big observation and one big concern from the current situation of funding cuts.
Sure. So first thing, just a quick clarification. I was the medical advocacy manager based out of Juba in South Sudan. And I was there at the time of the funding cuts. So already based off of so just to give a context of South Sudan, it is the poorest country, GDP per capita in the world. Already there is a system which significantly struggles from systematic issues. MSF has been in South Sudan for over 30 years as a humanitarian organization. My first vantage point that I could see was the system was already struggled. It was not a very well-functioning system. There's hyper-NGOization of the entire health system. Different parts of the health sector, of the global health avenues are being taken care of by different fragmented healthcare entities. And on top of that, the nature with which the health cuts took place and overnight led to such a chaos and such confusion within the system. First, initially, there was this information that came out that life-saving aid would not be cut. And then what is defined as life-saving? Was nutrition life-saving, for example? That was a question. Eventually, the US State Department clarified, okay, fine, nutrition is a life-saving endeavor. But at the same time, when they did allow nutrition services to continue, what ended up happening was you had tons of ready-to-use therapeutic food sitting in warehouses, but there were no budget lines for transport. There were no budget lines for making sure that ready-to-use therapeutic food is able to get to the clinics where the patients are. And as a direct result of that, even though on paper it said nutrition aid is not cut, but in practice, the nutrition supplies were not able to reach the populations which they were meant for. And it's just the brutal overnight exacerbation of already such a precarious situation within a struggled health context that was just devastating, and there were far-reaching consequences that, I mean, this is one concrete example of what I had witnessed and where we had to step in to generate funding and generate resources to mobilize them. But there were so many other things just like this, which basically never met the news cycle.
Yeah. So massive disruptions. So let's go a little bit into sort of a little bit more detail. So Sandrine, you're now working in Ukraine, right? You're working with local partners and in areas that are still under active attack, right? Where the Ukrainian health system is damaged, but also it's functioning to some extent. So from where you sit, how does the distance between the decisions, where the decisions are made and where care is delivered, what can you actually do, and where do you see the biggest constraint in action, in delivery?
Yeah, first, Ukraine is a very different setting. In Ukraine, the system is working. Hospitals are functioning, this is working. They had a health reform in 2018, and unfortunately the war happened in 2022, but the reform was there, family doctors, primary health care, it was there. But the issue with the funding cut, it's like now when a woman has an hypertension in the south of Ukraine, is this a basic need? Is she allowed to get the medicine? Who is purchasing the medicine for specialty? Because all the donors want to do primary health care, but sometimes they limit really the commodities to the basic.
And who are the donors?
The donors, it's definitely European Commission is one of the big donors. Then there is also the different European governments. Recently, the US, through the country-based pool fund, 134 millions that they want to localize and be implemented in 6 months. Then there is different, there is a vast set of donors. But the main issue there is that this reset, prioritization, hyper-prioritization, what you call localization, it arrived at a very convenient time. It's just sometimes another word for abandonment or withdrawal. And that's really what worries us with Médecins du Monde, because we need still to address the basic needs. And regarding your question, I think the problem is when apparent functionality, because an hospital functioning doesn't mean that we meet all the needs. And one of the constraints is when apparent functionalities is hiding many unmet needs. Secondary care is not funded, referral pathway is not funded, the care for victims of rape is not funded. There are so many issues which are lacking funds on the basis that it's maybe not humanitarian. There is also a different level of humanitarian need in a European country like Ukraine. It's very different if you are standing on a region in the front line, or if you are sitting in Lviv or Kyiv. All the country is under attack. The health facilities are under attack. They are destroyed. More than 2,000 attacks on health facilities since the beginning of the war. However, it's very different if you are sitting in a small village or in a city like Kherson under constant attack, drone attack, artillery attack, the drone disseminating landmines on the vicinity of hospital. The picture is grim. I don't want to get the mood down on the morning, but the picture is grim. Then what do we do? What do we do for that? The system is not catering for that because most of the donors, including ECHO, recently questioned if Kherson on the front line was humanitarian. then when you get to that level of lack of understanding about the field reality, yeah, you question. The last issue I will mention is that the system is strong enough to save life. But why is it strong enough to save life? It's because of the commitment of the human resource for health. A lot of human resource for health are now mobilized. They are on the front line fighting for their countries. But the other vast majority, mostly women, they stayed behind. I'm going to talk to you about Tatiana. Tatiana is a pediatrician. She's sitting in Kherson. She's the head of the regional health system in this region. She stayed there. She has a son. He was 3 years old at the beginning of the war, 7 years old now. She stays there. But is it fair that we abandon them on the ground that it's functioning and it's going to break, and how much it's going to cost to rebuild? That's one of the questions. And it's something also I wanted to ask my colleague about Sudan.
So, Sandrine, something you said about donors insensitive to or not fully recognizing the needs on the ground, even the conditions on the ground, like Harrison under constant attack and questioning whether humanitarian assistance is needed in a place like that. I wanted to ask Faiha, you've been in from the Ministry of Health. How have you experienced humanitarian agencies, emergency response, even when well-intentioned, how do they reinforce power imbalances that they claim, at least on paper, that they're working against? How have you experienced international donors and humanitarian agencies that come to assist? How do they help with your work, or are they standing in your way sometimes in providing the care that is needed on the ground?
From my vantage point, I see that the imbalance is often a natural byproduct of the emergency itself, the emergency situation. Even in the situation when there is no actual emergency, there is always a need. So this inherited gravity in relationship between one in need and one providing, irrespective to the intention. So even when we frame the response as technical or neutral, it is deeply political by design. Somewhere in this in the landscape, somewhere there, where the decision is made of where the fund goes and how it is earmarked, even if it's not really explicitly. So the imbalance is not just only in who has the money, but it's also in who is defining what's urgent, what is important at this moment. And also at the same time, I believe the balance cannot be found in the power, because the power is, there is an imbalance in the power, but in how we navigate its pros and cons. Because, for example, the interventions, even if at the system level or at the population level, is very well earmarked when it comes to the external funding. And the external funding also does not really tend to solve issues of the system that is very deep, like salaries or retention of the human resource. So I'll give you one example that features how the global response has the ability, or sometimes that see that power imbalance. For example, those global responses or organizations, they are very good in mobilizing local talents and experts. And they are the best in doing so, whether it's operational staff or admin staff. So they are localizing their action, which is very good because it is needed. They are the local expert. They are the ones who are able to navigate the corridors of the trust between their communities, or speak the language, or very good at accessing what is exactly the need. But at the same time, the hidden cost that is not really negotiable, and that is I personally sense, is the decision space gap that is the experts face when they actually became part of an external organization, whether it's international or not. So they have that shrink of the decision space, although they are the experts. So they're following a protocol of another system. They have a least power and authority to mobilize and immediately react. That is something we face. The other thing also, because usually the external fund tend to provide a career path or salary that is not competing, the national government, or usually the systems, especially when they're in distress, they're not able to compete with it. So you see that internal brain drain. So suddenly the offices at the governmental there is no one to actually to execute, and then there is a natural creation of a parallel system that is where the NGOs actually has to take as a consequence sometimes. So they're literally emptying the best staff out of the national system.
Yeah.
So the existing the architecture of this third party, it's really you can see the impact of those power, even if it's not spelled out.
Yeah. So humanitarian assistance can leave health systems depleted because the best staff are poached or leaving for better salaries, better conditions, etc. Right? That's one outcome. Now, I just wanted to ask Hassan, you've been an internal critic as well. Maybe you can reflect a little bit on how humanitarian agencies set priorities and whether they actually respond to the needs of the people. Is there a gap between the priorities set by agencies and the actual needs on the ground? And if so, how can we address that?
So let me just preface by saying that humanitarianism is certainly a very noble endeavor, and there will always be times when surge capacity is needed in order to fill gaps in the system. However, that surge capacity has to be limited, time-bound, has to have very strict entry and exit modalities, and they have to ensure that the system is handed over to a local healthcare actor so that it could be run in a long-term sustainable manner. Now, I just mentioned South Sudan. MSF has been in South Sudan for 30, 40 years. 40 years of a humanitarian emergency response is certainly too long a response. At some point, we should stop and think, are we running a parallel health system to the local Ministry of Health system? Is it the fact that all the investment that we did over the years, just to give you an example, we just spent 4 million euros annually on jet fuel alone in South Sudan, airlifting, all of the drugs, staff, resources to our projects. Now that's a huge amount of money just on airlifting stuff. And how much of it could theoretically have been spent? I'm not saying it would be the responsibility of an international NGO, but just imagine if the same amount of money could have been utilized to spend on infrastructure that could have led to a long-term sustainable condition of the system. In that particular case, even if you get to leave the country, you still leave behind trained staff, trained infrastructure, a capacity which could then continue on with limited resources and limited effort. But at least you leave something behind. Yeah. And yeah, that's where the challenge is. The humanitarian interventions are just too cost heavy, too top down, and more often than not, community engagement and understanding the actual needs of the community is an afterthought rather than something which is done at the very beginning and included as a part of the programming.
Sadako Ogata famously said that there are no humanitarian solutions for humanitarian problems. Exactly. I mean, what humanitarians respond to are political failures. And Sudan is a very, very good example. 40 years later, we put out a few fires, but the country is still burning in a big way. Sandrine, you had a question that you wanted to ask Hassan, Go ahead.
Yes, I wanted to ask you, Hassan, what was the situation when the funds were cut in South Sudan?
I mean, like I mentioned, the country is so heavily reliant on these external actors, which basically run the entire healthcare system of the country. Everything from emergency response for cholera down to routine mother and child health programming, nutrition programming. It's all run by the health cluster. And when the system is so dependent on these foreign entities, and all of a sudden these foreign entities lose their funding overnight, it's all of a sudden there's a domino effect. The international organizations started firing their staff within 48 hours notice, and immediately there was a state of chaos and confusion. There were people who were expected to be in a particular position were no longer there, and that left a lot of gaps within the system. One classic example is, so the UN has, the Humanitarian Air Service is used by all the entire humanitarian sector to airlift their staff as well as supplies within the humanitarian zones. And when UN has got its funding cut, I mean, it was declared as non-necessary funding, all of a sudden that meant that other humanitarian organizations which were reliant on the transport services were no longer available. Similarly, the Global Fund, for example, had major funding cuts, and the biggest funding cut that they received were community health workers. They were deemed as, because they're HR, they're too costly. And that is essentially the most important part
The
of
basic
the
building
basic
block.
building block, which was historically took decades to be built in order to mobilize, train resources to reach those communities in far-flung areas. Now, all of this capacity that was built over decades is the first one to get cut. And it's such a pity that, all of the wins were just undone overnight.
And if I have, maybe you have a comment from the Ministry of Health perspective, how sort of what was affected the most and what will be the most difficult to recover from this sort of round of cuts. And not just the cuts, but the structure as it is affected by conflict, but now on top of that affected by cuts as well. What will be your biggest challenge when the conflict ends?
I think the biggest challenge that can be faced is in the location where there is no actual system, but they were dependent on the external fund and external organization. Because the current practice, there is no humanitarian development at the same time. So it feels like there's a stability, there's a sense of achievement, and there is a lot of achievement have been done, a lot of opportunities, but that will be a shock when everything drawn, if it's not handled carefully. Because the cut of funds now, so we saw that that shock already, they have been felt, but we can imagine if this haven't been contained as soon as possible, it will be catastrophic to some places.
So let's just look ahead now. I mean, we've sort of gotten, you all sort of outlined some critical failures, that it's not just about the cuts, but it's also about how donors operate, how humanitarian agencies operate, and years of dysfunction that we're talking about. But we are at a moment. I live in Kenya, a lot of Kenyan civil society think of this moment as a decolonizing moment where change can happen. So think about from that perspective. Let me sort of ask you, Faiha. So in a really reformed global health architecture, what role should national and local health systems play? not as implementers of internationally designed programs, because you kind of hinted in your previous response that sometimes you're responding to donor priorities rather than your own priorities. So how do you get back to a position where you can set the agenda, you can set the priorities, and you can implement it? What needs to change for you to be able to do that in the Ministry of Health?
I think there is two tracks. The first track is at the national level, and I think the current financial cut, although it was really catastrophic, but it was an eye-opening. And for example, in Sudan, they started to seek other avenues for funding that is bilateral or non-traditional donors, mobilizing local resources. So this is the start. So the countries need to be able to find avenues where they can have diversification of the funding and build the national funding capacities. And also they need to advocate and actively participate in priority setting at the global level and architecture of the systems. For example, we have the policy of hit and run model, for example. Doesn't seem to be effective on the long run, and this is, as I mentioned, when the cut or the crisis subside, this is the first thing that we feel when there is no actual build on the ground. At the global level, I believe there's a lot to be done, and the literature already catching up on that. But I still want to mention something very specific: is the trust. The trust in practice, not the trust like feel-good trust, but actual trust in practice, and that's what's we manifest a lot of requirement, earmark funding, all of those delays in the implementation. So I think from the global level, they need to actually practice the actual trust when it comes to the local or the national response. The other thing that I find really important is the design of the system itself. So what I see is the system globally is designed for a well-developed national countries, I would say, more stable systems. So that's why there's a lot of requirement, there's a lot of expectation when the countries are in the worst situation. So even sometimes when the country finally receive the fund, because of the requirement, they find it very impossible to absorb all of that fund. And there's the issue of the time frame. There is money, there is a need, but there's a time frame. So there's a lot of models that is practiced, need to be changed at the global level as well. And also there is terminology that we're talking about moving from localization to health sovereignty. So the countries now need to own and to enforce their global agenda, their national agenda. So this is what I would take for now. Yeah.
So, Fahia, for the audience, can you tell us what percentage of Sudan's budget is allocated for health, and what is that at the moment?
I don't have the statistic number at the moment, but at the moment, health is at the priority, which is something wasn't really the case before the war.
Yeah.
They are prioritizing that, so there is a lot of funded being mobilized for infrastructure, for retaining of the health workers, all a kind of building of the hospitals, infrastructure. But the numbers I don't have at the moment, but they are.
Like what, 5%, 6%? You don't know.
Difficult to mention at the moment. Yeah.
So Abuja Declaration, sort of the agreement that a lot of African countries came to was to allocate 15% of their budget for health, education, social services, etc. Very few countries really reach that level. And so a lot of countries are reliant on overseas development assistance, but the budgetary allocation for these services are quite low. Now, coming to Sandrine, I mean, I think Fahia is very clearly, from her perspective, what it needs for government to take ownership of their own agenda and how to implement it. Do you, in the position where you are, what are the tensions from an operational perspective? And can you sort of lay out some principles that should guide this reform going forward? I mean, it's a big ask, but if you can think through.
Thinking about reforming the system, it's first, as Farah mentioned, it's the time frame. It takes a long time, and we cannot have a funding cycle which are too short. We need multi-annual, flexible funding. The funding for reforming the health system need to be granted at ministry level. And I think it's where maybe collectively we need to change the way we are doing business. We humanitarian organizations arrive in a place and do what we know how to do best, deliver. We deliver medicine, we deliver nutrition, we deliver water, we deliver. But we have a way of working that may disrupt an equilibrium that took a long time to establish. In Ukraine, the system is functioning, as we mentioned before. They have specific needs that are not covered by the humanitarian system because it's not really the way we are doing the business. Their need is not covered by development funding architecture because it's not yet in place. Because development donor thinks, yeah, it's an active conflict, it's not yet there for development. The World Bank is there, but we know how long it takes to engage. Then for me, a good reform will be a reform that flows through the existing structure, not around, and which is really pulled by the local authorities, by the ministry. A second principle will be don't romanticize handover. Don't romanticize localization. We all want localization. But yesterday we were talking about localization with OCHA. And it was great. But what we don't hear when OCHA talks about localization, it's, for example, he was saying that 2/3 of the country-based humanitarian funding went to localization to local NGOs. In Ukraine, the analysis shows, for example, that 57% of the ECHO budget in 2025 went to UN agencies. Then when we talk about localization, what is really the localization about? That's something we should keep in mind in our principles. And the last one, yes, it's continuity. We cannot reform thinking, okay, let's stop and reform. No. We need the continuity of care. We need to make sure that the people we are aiming to serve are served. And then we do the reform around it. We don't stop from one day to another vertical program. We make sure that they are integrated in a package of health services. That's my
I mean, something that we always talk about humanitarian assistance is that you're not going to sacrifice lives today for a system that might be built tomorrow. So, Hassan, as a humanitarian actor, what do we need to do different? I mean, we are well-intentioned, at least we think we are well-intentioned, but we know what well-intentioned European missionaries did in Africa and Asia 200 years ago. So good intentions are not enough. What is it that needs to change in the way we work? Because also an emergency does not mean that you can ignore the long-term needs of any country, right? So what needs to change in the way we do business, where we act? So be as critical as you need to be.
I think the road to hell is paved with good intentions.
Yes, exactly.
I think if we come down to the bare bones of what we're discussing, it comes down to the needs of the population, right? Whether it comes through the vehicle of a humanitarian donor or a development donor, the bare bones of the matter is the needs of the population, particularly the healthcare needs of the populations, need to be met. Now, it is true that historically the way we did things were too top-down, too us-centric rather than the population-centric. We decided what the needs of the population within a humanitarian system or a humanitarian intervention need to be, rather than asking the population. And I think it doesn't take much to realize that if we continue on with this tangent, we are burning through resources which are such a precious commodity at this point in time when the entire global health system architecture is struggling with resources. And the few organizations which have the luxury of having these private donations resources, they really need to think, how do we make sure that this pool of resources that we have, how do we make the biggest bang out of the smallest buck? And that happens only when you are actually talking to the populations, listening to them, understanding their needs, doing programming which is tailored, suited to their needs. Don't come in with big, flashy programming. Don't come in big, flashy Land Cruisers. But basically have an intervention which is suited to their needs and something which can be carried forward. One unfortunate reality of the funding cycles, as everyone mentioned, unfortunately the funding cycles are at times so short that what ends up happening is this frenzy of wanting to spend for the fear of not underspending and not getting any resources later on. That often at times what you see at the end of the years, at the final quarter of the year, is a spending frenzy to buy Land Cruisers, to buy video screens, to renovate the conference rooms. And then that is essentially misuse of resources. That's an inefficient utilization of resources, and it's essentially like a tail wagging the dog rather than the other way around. And that sort of a system, when you have that sort of an accountability mechanism which disincentivizes efficient use of resources, I mean, you have to stop and think, okay, we have a problem here. How do we solve this problem? I mean, if there needs to be earmarked funding, it has to be over a longer period of time, and it needs to incentivize efficient resource utilization.
So my advice to some of the recipient countries have always been, your biggest power is to say no. We do not accept these conditions and we do not accept this money, right? And that, very few countries actually exercise that because they feel that money can do so much, and if we say no to this money, we might not have more later. I want to open it up to the audience, but before that, any of the panelists have questions for each other? No? Audience, are there questions? Okay. 1, 2, 3, 4. Okay. All right. Keep your questions short, and if you want to direct it to one of the panelists, please do.
Thank you so much for the interesting talk. I think I have 2 questions. The first one specifically for Sandrine. You mentioned that in Somalia, actually the nexus is working well. And I think it's really key, right? Because it needs to have the donor, the development actors, and the humanitarian actors working together to build the healthcare system. So can you explain? Can you tell us how it worked, what made it successful, and what insights could be applied to other situations? And then I think the second question, maybe for everyone, is I think you mentioned that it's necessary to look at the needs of the population. But I suppose the complexity of healthcare is that there are so many needs and so little resources. And so the decision making must be at the hands of the national governments and the local people. And so I want to understand how, for example, MSF, you've worked in South Sudan for 40 years. How can that decision, it was taken by MSF, how can you then shift that decision-making to the national actors and to the local communities?
Yes. We'll take one or two more questions, and then we will come back to the panel. Yeah, there's one behind there.
Yeah, thank you. Well, I think my question is kind of trying to look at health systems from the lens of non-communicable diseases, as we will talk about systems. With a big part of that is also primary care, community interventions, things that all of you have actually mentioned. And on services being affected by global cuts, how were NCDs affected, especially that they were always probably historically known as being under prioritized or not really kind of funded enough? Maybe it depends from one organization to another, but probably I'm more interested from a system level. Probably Dr. Fayha, you could answer that. And any kind of indicators that have been used, maybe Dr. Hassan, you can kind of reflect on that. Being in South Sudan, MSF has been in South Sudan for 40 years. NCD services there, how have they been affected by the cuts? And also any indicators of preventing NCDs, preventing complications of NCDs, and how the health system has been resilient on NCD services in South Sudan.
All right.
As well.
Well, we'll take one more question here. Here. Yeah.
Hi, thank you very much for your presentation. It's really interesting. I have a question for Sandrine. In Europe, the agenda is moving towards preparedness for conflict. So Ukraine may be looked at as a blueprint for humanitarian interventions in a functioning healthcare system, for example, as well as many other functioning systems within the country. What is the lesson learned in terms of describing the complexities of needs, of medical needs in particular, that you hinted to as donors? What can we do as humanitarian actors to be better prepared for that kind of complex crisis? And what are the indicators for a responsible exit strategy? Thank you.
All right. So we'll go to the panelists. Just two notes I want to make. One is, yes, MSF has been in Sudan for 40 years. But don't forget, for the first 25 years, it was Sudan. And the last 15 years, it was South Sudan, right? And now we're talking about a very young country with very little resources. And a lot of the times, if you want to talk about health system, you have to have someone in control nationally to be able to have that conversation. And sometimes in places we work, we don't always find that, right? Just to keep that in mind. That's not an excuse, but that's something that we need to keep in mind. Second thing is, health system is not just one thing. It's not a static thing. It's a very political idea. The health system in any country is a political decision. Even in America, even in the United States, if you elected Bernie Sanders, you would get a different kind of healthcare system. And if you elect Trump, you get a different healthcare system because it's inherently political. And who are we to make that decision as outsiders, right? So that is also why it is important that we have to have these conversations with the people we are there to assist. So let me go to Sandrine first. There were questions on Somalia, and then there were questions on Ukraine for you.
Thank you very much, Abby. It was working. Sorry to disappoint, but it was working. Humanitarian actors, development actors work together to try to integrate all those vertical programs that were draining all the resources that we discussed also here. and make sure that it was more efficient. I think I added the piece, the P of the piece of the nexus, because having a system working in a country is having people being served in remote area, having access to healthcare, it's human resource working, community having access, and that's a dividend for peace. I think peace is built there at community level. It's not always like it is based on a political decision, definitely, but it translates immediately. Those engagement, political engagement, translate immediately at community level. Yeah, unfortunately, it's not all gone, but it's not going very well. To come back to your question, thank you very much, on preparedness for conflict. Ukraine was prepared, I guess, because we have been preparing forever they exist. It's like South Sudan. They were at risk from day one, and they prepared. But preparedness comes with funding for preparedness. We've been advocating for the last 20 years for more funds to be dedicated to disaster risk management, to disaster preparedness. And as soon as there is funding cut, that goes first also. Then community level goes first, second disaster preparedness, and then we are again reactive rather than to be proactive in preparing, in planning, in stocking. Even now, some donors who accepted, like 10 years ago, they were accepting, for example, Médecins du Monde, to have a stock of equipment, health equipment, and stock of medicine available for emergency response. Now it's very difficult to fund that. They don't authorize. Then the lesson learned is we need to be prepared. Maybe we need to use our own funding to be prepared, to pre-positioned, and to stop waiting for the donors, for the institutional donors, to take action. I'm talking about this from my experience with MSF, where we were blessed to have private funds, and also from the perspective of working with Médecins du Monde, where we have a chance to have also private donors who allow us to have this independence, the capacity to act immediately upon a disaster wherever MDM is thinking it's worth or it's important. But not all the NGOs have this capacity.
But independence, there's no such thing as true independence. Yeah. True independence is the ability to choose your dependencies. You know, we are all dependent on actors locally, but that we make those decisions based on proper assessments, etc. Right? The question about chronic diseases and the health systems that gentleman asked. Do you have a response? Or to the other question, the second half of the question.
Yeah, I think you rightly mentioned that a country as young as South Sudan, I mean, there is virtually non-existent health system to begin with. I mean, the country has essentially been at war for most of its founding, and it has a functioning humanitarian development nexus as well. And that's hats off to the humanitarian endeavor that, you know, people still find a way despite all the fragmentation, despite the worst of the conditions. Different NGOs, local and international, continue to find a way to work together, to fill the gaps. And they basically run the de facto health system, and it's semi-managed by the government. Now, when we talk about NCDs, in a place like South Sudan, it is already so down the priority list. In a place where you have multiple malaria outbreaks, you have the active biggest cholera outbreak in the history of the country. You are currently in the midst of funding cuts for TB, HIV. You are massively struggling with you're massively struggling with the bed net distribution because malaria season is approaching. I mean, within that context, the NCDs are not even a part of the discussion anymore.
So it's still in epidemiology. It still hasn't transitioned to
exactly.
Yeah.
I mean, it's just the nature of the context hasn't allowed there to be enough stability within the health system for a topic like NCD to prop up.
And maybe that's a question for FireHub, because I think in the north, they have that dual burden of, in some parts of the country, you have infectious disease epidemiology profile, and in other parts you really have to deal with chronic diseases and services for chronic conditions. How do you sort of balance that as a system with all the challenges that you have at the moment?
Yes, it's true. There is this double burden even before the war. And even before the war, the NCDs wasn't at the top of priority. There's a lot of initiatives that are coming up. But I would say in the design already in the humanitarian context, even the strategies that are used to the humanitarian response are not supportive to the NCDs. So when the fund cut happened, all the system has been affected generally. So the supply system for everything has been affected, the services, everything, the human resources. But the NCDs themselves, they took the biggest hit, I would say. For example, when the war happened, some location in the Sudan, in the country, there is 100% mortality of the people who's doing dialysis, because there is other needs, there is other prioritization. The cut, any disruption of the NCD's treatment or interventions, it's bigger impact. So I would say, for example, in Sudan, there's other NCDs that is coming back when the system is starting to stabilize. You can see that as NCDs are coming back into the priorities list. There's interventions, and mostly I think the interventions will come to the NCDs from the developmental partners more than the humanitarian partners, and that is very important when you talk about the nexus. But look at the nexus, looking to the two arms, where there is humanitarian going on and there is a developmental that is looking to the lifelong effects of health impacts, and that is very important. And also, I really would like to respond to the question of the need of the population. And I think the need of the population, or the population needs, tend to be wide and tend to be very much, there's a lot of needs, and everything in the needs. This happens when you don't include actually the population of the community, because the community are very good at pinpoint exactly within this list what they want to be done first. And this is not necessarily the situation when it comes to when an organization or a need assessment just being done, because they pick up everything. So I think when it comes to the population needs, when it is moved to the local authorities, to the local community, it will be easier to identify the gaps. The population tend to have different gaps. And we have done this during the war in Sudan through the support of the WHO. We went to the community, because there is no much funding to do everything. We need to know exactly from all this list, what can we be done first? And when the community engaged into the decision making, into identify their needs, you'll be surprised of how they prioritize, and how they actually help in bridging those gaps, even at the system level. They can return your human resource. Can they support you in building the infrastructure? So you're left with some resources to cover extra needs for them, for example. They can support in the supply chain. For example, in Sudan, in Jazeera, when there is the cut of the supply chain, they were the one who who actually actively able to bring medicine to their villages. They were able to return some of the health workers. They were able to allow other, for example, displaced health workers. They support the system for them to be engaged, and so on. So I think perhaps the transition from who is making that decision from an external actors to the internal actors is very important. And within the internal actors to go at the lower level with the communities. And that will ensure better need assessment and response.
I think both Sandrine and Fahab sort of put the finger on the notion of resilience. I think Ukraine, you have, despite all of the challenges of the last 4 years, I mean, an incredibly resilient system where people are able to come together and still deliver at a reasonably high level. And to a certain extent, I think that's also what Faiha has been talking about, that even in times of conflict, that the system in some places, in some communities, are able to come together and deliver. And this sort of also shows, the depth of systems, how they can recover from conflict, how they can respond in times of crisis as well. And so there you have opportunities for humanitarian actors to engage and sort of work with, which unfortunately may not be present in South Sudan. Given how young a country is, the resilience is very low. Maybe one question. Yes, one question here.
Thank you. Thank you very much. My name is Ines. I'm director of Handicap International Germany, part of Humanity Inclusion Worldwide. I really thank you for your very inspiring presentations and discussion. And I thank Dr. Fayha for mentioning at least disabled people in your presentation. Now, all 3 countries you are referring to are in war, and the amount and the percentage of people with disabilities during war raises from 15 to 20 to 50% in many occasions. And people with disability in war are most at risk of dying and of being left out. Now, when we talk about reforming global health, how do you think can we ensure that people with disability are systematically included into the system, are consulted, are taking part in decision-making, and are not left out as systematically as they are currently being left out? Thank you.
Thank you. All right. So let's do a round and also perhaps address that question, but also maybe your concluding remarks, and then we will close it after that. So maybe Hassan, will go with you first this time. Think about disability, but also a closing for the session.
Yeah. I wish I had an answer to that question, in all honesty. Again, let me just take you back to the context of South Sudan. A country so young, so struggled. 95% of the exports of the country is oil through a single pipeline, which is blockaded in the former north of the country, in Sudan. I mean, the priorities within that particular context, and you have basically an active civil war where the soldiers who don't die of bullet wounds end up dying of cholera. In that sort of a situation, it's just everything becomes such an immediate active priority, and mortality reduction becomes the primary priority of many of the humanitarian actors, just to save lives. And that in itself becomes such a momentous challenge within that struggled context, that everything else for the time takes a back seat. And I unfortunately also mention that disability is one of them. War-wounded soldiers, children who've been at war, injured during the war. I mean, all of these populations are just systematically, unfortunately, marginalized, and there's just not enough resources to go around. And that what brings me back to the conclusion of this discussion. I mean, sitting here in Berlin, many of us who live here, live in a place of such excess, that thinking about
Excess or access?
Excess.
Oh, right.
I mean, excess of resources, a place of such privilege, that to be able to think about those on the fringes is a privilege. But in a place like South Sudan, which is so poor, so desperate, so much in need, I mean, just barely surviving is at times becomes a privilege. And I think that's the frame I want people here to understand, that when we talk about funding cuts or humanitarianism or funding, I mean, seek to it that they are also living, breathing human beings just like ourselves, with the same needs as ourselves, same wishes, hopes, dreams for a better future. And at a time when we are not even allowing, or the situation doesn't even allow just bare survival of the population.
All right, thanks. Sandrine, I mean, Ukraine, I mean, disability is an everyday reality. I mean, the more, war injuries, etc., and
yes.
the context is...
Thank you for this question. In Ukraine, there is a silent tsunami arriving in the health facilities, and it's the reintegration of the veteran population. They are slowly, some of them have left the front line because they are injured. And when we talk about investing in a resilient system, while it's still holding, that's what I meant also. The system in Ukraine needs to cater for this large population of persons who will be injured. When we think about disability, we think about physical disability. There is more than 100,000 persons who have lost a limb in Ukraine over the last 4 years. It's gigantic numbers. None of these European countries are able to absorb the work it takes in terms of rehabilitation, physiotherapy, and so on. But it's not only that, it's all the psychological injuries, all the person who will suffer from PTSD. I mean, this constant bombing, the lack of sleep, 4 years, I mean, we are very humble looking at the work they are doing. And I think we need to continue the work. We need to make sure that persons with disability are included in our programming from the beginning. We need to think about vulnerability focal point. We need to make sure that this great idea of HI is mainstream for our programming. And we need to uphold to our word. I mean, all the European countries signed the UNCRPD. Then that's part of the deal. Then we need to be inclusive, and I think we are aiming to, not enough.
Yeah.
To finish, I will concur with my colleague. I think we need to stay driven. To stay driven doesn't mean that we collectively going to change the world. We try to shape a new health system together. We try to stop the waste of resources. We aim to do better, but we need to be driven and we need to be humble. Stay humble, look at the community. When you question if reforming health system is worth, go back to the field, look at the community, and surely when you wake up in the morning, you know it's worth.
If I have a very quick wrap-up.
Yes, I just wanted to say situations are of the conflict is getting worse globally, and systems whether they are developed like in Ukraine or underdeveloped like Sudan and South Sudan, they are continuing to suffer. And I think as someone from the national level or speaking on the national level, I would call the global community, the humanitarian actors, the development actors, to come together and remember the mission. Eventually, we are all either international organization or national system. We are serving the population. And serving the population comes with a lot of responsibility that we need to shoulder together. Resources need to be allocated equitably and redistributed equitably, not to be driven by politics or any standard that not really speak to the mission. And thank you all for coming. I think this is a moment when we need to stand and we actually put the reform that we thinking of in action.
Yeah, thank you. To your point, recently I was invited to join a consultation between the Dutch government and civil society on funding cuts. And one of the points that I made was that now we are shifting funding from ODA to defense and to military spending, that defense spending, military spending should also include funding for the consequences of military spending. So in the situation like Ukraine, that is the consequence of war. There will be high numbers of people who are disabled, and any funding that moves from ODA to defense and to military spending should also, and I think that's a job of all of us as civil society actors, is to push governments to include the consequences of that spending also, you know, in terms of health consequences, mental health consequences, etc., etc. So I'm not going to try and summarize all that we've heard, but I just want to leave the room with just one thought, because it's the key point of the session. Humanitarian assistance can harm health systems. And not through malice, not through incompetence, but through the logic of the response itself. Right? The speed, the parallel structures, the incentives that pull skilled workers out of public systems, as Faya has just said, the supply chains that bypass national procurement, the data that flows to donors rather than to ministries, done at scale over time. Humanitarian health action can leave a system weaker than it found it. Right? Haiti remains as a good example. We didn't talk about it that much, that we should really think about. The international response after the 2010 earthquake, and of course the cholera that followed it, was huge. Right? But it was built around humanitarian actors with minimal integration into Haiti's own health system. Now, when the international community eventually withdrew, it left behind a system really depleted, because the health system was gutted because people left the health system to work for higher paid NGO jobs, right? And we left Haiti, or when the emergency was over, Haiti was less capable of governing its own health response than before the crisis began. So these are things that we need to think about. Now, this is not an argument against humanitarian assistance itself, but it is an argument for humanitarian assistance that takes seriously its ethical obligation to do no harm, right? And where harm cannot be avoided, because humanitarian settings, there is always some harm, there is an obligation to minimize harm, to be honest about it, and to take the responsibility for it, including the longer-term consequences of how the response was done and how we leave a context. Now, humanitarian actors also need to be clear-eyed about the power they wield, right? Over resources, over priorities, over the shape of care itself. It is not for us to decide what a system that we should put in place in the country. We should be there to support. Strengthening health systems does not only require funding and technical support, it requires the ceding of power. It requires the ceding of space and the willingness to measure success not by the scale of one's own presence, but by the growing capacity of others to lead without you, right? Replacing a health system is not the same as supporting one. The difference between substitution and solidarity, between a response that depletes and one that builds, is precisely what needs to change. So we heard from all of them today. They understand what the challenges are from inside. The question for all of us, and also when we continue to think about these things for the rest of the day, is whether the sector is finally willing to act on it, not in the next strategy document, but in the next response. So thank you all for coming today, and thanks to all of the speakers, and for joining very early in the morning, 3 in the morning in New Haven, Connecticut. Thank you so much. Yeah. Okay, so we have the next session, Power, Values, and Violence, the crisis of humanitarianism in times of declining norms. We have it here in the same room, and humanitarian action under threat, risks of criminalization and harmful information in a digital world at the Betonhalle. So thank you all, and enjoy the break and a coffee before the next session starts. Thank you.
Hi, everybody. We're going to wait a couple of minutes to allow others to come into the hall, but I would encourage anyone who is on the fringes to come and take a seat. Thanks. Okay, I think in the interests of time, we can make a start. Thanks so much to everyone for coming to join us this morning. My name is Freddie Carver, and I'm the director of the Humanitarian Policy Group, HPG, at ODI Global. And really, it's a massive honor for me to be moderating this session today. We have a truly stellar panel of speakers to talk to, I think, an issue that is of such critical importance. It was woven through all the conversations, I think, that I was part of yesterday around the Congress on this issue of IHL and declining norms and how the humanitarian sector responds. I want to start by just quickly introducing the panel, explaining who we have in front of us today. First, I want to introduce Her Excellency Dr. Fatou Bensouda, a Gambian lawyer and international jurist who, since 2002, has been the Gambian High Commissioner to the United Kingdom, but I think is best known for her role with the International Criminal Court as the chief prosecutor between 2012 and 2021. And I understand from talking to Fatou just now, the recent recipient of a Lifetime Achievement Award from the International Law Association in Nigeria. Welcome, Fatou, and thank you so much for joining us today. Then we have thank you. We have Professor Sultan Barakat, a globally recognized authority on conflict, humanitarian response and recovery. He's the Professor of Conflict and Humanitarian Studies at Hamad bin Khalifa University in Qatar, and also an honorary professor at the University of York. And the list of organizations and institutions and countries with whom he's held senior academic and advisory roles is too long to list now. Again, Dr. Sultan, thank you very much. Then we have Dr. Lina Gong, assistant professor and program director of the BA in International Relations at the Jean Jarton Liverpool University in Suzhou in China. The focus of her research is on humanitarian affairs, China-Southeast Asia relations, and non-traditional security in Asian environments. She was previously a research fellow at the S. Rajaratnam School of International Studies in Malaysia, where she worked with the government of Singapore, ASEAN, and the UN. Again, welcome very much, Lina. And last, but very much not least, Dr. Cordula Duruga, the Chief Legal Officer and Head of the Legal Division at the International Committee of the Red Cross. She leads the ICRC's efforts to uphold, implement, and develop international humanitarian law, and she's been with the ICRC since 2005. Finally, welcome, Cordula. So I think the panel speaks for itself in terms of its experience, its skills, and the diversity of its views. So I'm going to keep my introduction really to a minimum. But just a couple of words to frame the conversation that we're going to have. And maybe actually the best framing was given yesterday morning by Hans-Jörg Strohmeyer from OCHA, who I think in that keynote session, one of the phrases that stood out for me was that he said, "No one gives a rat's ass about international law." So I think maybe that's a good place to start with our conversation this morning. I think in the conversations, and there are many of them, about how the political environment globally is changing and how the approach to norms and to IHL is changing, it's always important to remember that there are many people around the world, many communities, many populations, for whom international law has never delivered and who have never felt protected by the notion of international law. But at the same time, the story of the last 80 years of global relations has been one of an extraordinary attempt to create this international normative framework, building on many centuries of previous experience. And a framework that was upheld, at least in theory, by the major powers of the world to some extent. And I think it's unarguable that in recent years, we've seen an extent to which those major powers that have been responsible for protecting this framework have increasingly operated by ignoring them. If we think about contexts like Sudan, like Gaza, like Ukraine, most recently in the Middle East, Tamam yesterday talked about the fact that within the last couple of years, there are at least two widely recognized genocidal campaigns going on. The extent to which these norms and these frameworks are under threat is undoubtedly very significant. And this has a huge impact on the humanitarian sector. It's always important to say it's not the fault of the humanitarian sector, that's clear, but the humanitarian sector needs to understand the extent to which we're bound up in them. There's always been a tension between meeting people's basic needs in the crisis, in the context of crisis, and also seeking to protect their rights. And I think when the threats to those rights become more extreme, that presents a challenge to humanitarians. And if we think about a lot of the discussions here that have been happening over the last 2 days in other settings like this, we talk a lot about placing people at the center of humanitarian action, putting more local actors who are close to the ground in positions of authority and power. What do we know about what communities' most basic and urgent priorities are in context? It's safety and security. We have plenty of evidence for that. So what does that mean for humanitarians that struggle to manage these kind of political questions? And this raises really serious questions around legitimacy, around access, around how we justify our work and how we find space for our work. And those questions are both strategic and they're also very real on the operational side as well. So how do we navigate this complex space? So that's, I think, the frame for the conversation we want to have today. We're going to have two rounds of discussion with the panel before hopefully having some time to hear from the audience as well. We're going to start by focusing on what is the nature of this challenge that we face and how does it look from different perspectives. And then hopefully we're going to talk a bit more about what do we do about it. So to start us off, I want to turn to you, Sultan, and reflecting, I mean, you're based in Doha, reflecting on what has been happening in the Gulf in the last few months. I'd love to hear how these questions look from your perspective. Are we witnessing a structural shift in the relationship between power and humanitarian values? And what does that mean for humanitarian practice?
Thank you so much, Freddie, and thank you for inviting me to speak here today. I think the shift has been happening gradually over the last maybe two decades or so. And I would, if I were to ask when did it really start, I'd probably say around 9/11, when we all started to tolerate, a little by little, that some people do not deserve the humanitarian response or action or protection simply because they've been labeled as evil or they've been taken as terrorists and so on. That is fine. That moment, I think, has started to compromise on our ideals and our standings. And unfortunately, a lot of humanitarian actors went along with that pattern. Until today, in fact, those of you who know Syria, for example, well, or northern Iraq, will know about the camps that still are occupied by the so-called ISIS families. Some of those were children at the age of 2 or 3 or just born. Now they are young men and women living in isolated circumstances and with no or very little care, just enough to keep them alive. And I think that gradual erosion of norms that we collectively have allowed out of fear of terrorism and out of fear that has been placed in our hearts by the very few has led us to where we are today. And the greatest demonstration of that has been the genocide in Gaza. I think the actions that were allowed in Gaza, or the way we turned a blind eye to it, is really the peak of having lost our humanity collectively and having really compromised on a lot of the norms that we had agreed to. Why I say Gaza, not necessarily Sudan, although Sudan is as ugly. Gaza, because it was carried out by states, not just Israel, but also backed up by the United States, the superpower, and then many other states took a position where they backed it up. In Sudan, you could always say, well, these are people who are fighting each other. It's a civil war. They don't understand. It's blah, blah. You know, I'm not justifying it, but I think the fact that states have started to demonstrate to us that these norms do not apply equally to everybody. You must understand that when power dictates, power wins. So you have to respect where our power comes from. And this, of course, builds on what Russia did in Ukraine, and now what Russia will do further in Ukraine, and what China may be doing elsewhere, and so on, because now they open this gateway of lowliness or power is right that I think we're all ultimately going to suffer from. Obviously, those who rely on the law will suffer most, and I'm not a legal expert. We'll hear more from the legal experts in a minute. But small countries like Qatar and many others around the world, and medium power countries, they rely on the law to protect their sovereignty. This is how they've been created. This is what they need. There you find them almost always principled and wanting to protect the law, wanting to protect the international institutions that have generated the law and so on. Those that feel that they could be above the law, either because they have the power or because they can intimidate everybody else from speaking out, or because they can stall processes within the UN circles, give less, I think, concern, particularly to the international humanitarian law at the moment. Now, a few things have also advanced that made things more complicated, aside from the compromise in our moral stand on who to protect and where to protect and who is a human, who's less a human, and so on, is the incredible advancement in technology. And I say this with, again, reflecting on what happened in Gaza, but also what happened in Lebanon immediately after, and what took just now, or taking place in Iran. The incredible implementation and use of artificial intelligence and software to target people based on their phone number and to kill them regardless of the fact that in the same block there will be 20 other families, civilians, innocent, that doesn't matter. We need to get these people. And the speed in which it's done simultaneously, like the attack on that Israel did with the pagers in Lebanon. 4,500 victims instantly, regardless of their political stand or their enmity to the Israelis, and everyone who stood by them at the moment, be it a child, a woman, whoever. And we saw a similar campaign in Iran recently. And I think that is something that we should really keep us from sleeping, because it is coming And it's going to be stronger and stronger and stronger in the way forward. The second, which I find also very worrying, is that the very United Nations that created that norm since the Second World War and tried to protect it, is now under incredible pressure, not just to be dismantled and weakened. And you know, all the UN agencies, one by one, they've eroded their funding. The latest is WHO and others, UNRWA for the Palestinians and so on. But it's under risk of being replaced. And I think we should look very, very carefully at this Board of Peace that was created by Trump in the last few months. This Board of Peace, although it was built on the ruin of Gaza, in fact, if you read the charter, it does not mention Gaza. It has declared an individual as the president or chair of this board for life, and it has had now more than 60 countries joining the board. And they're still trying to recruit and bully other countries into joining this board. So in a way, it's becoming a mini UN without norms, without any agreements, without bypassing a lot of things. And the worst thing from the UN perspective is somehow it got passed through the UN Security Council as one instrument to sort out Gaza. But today, Trump is using it to sort out the war with Iran. And this is why Pakistan, out of nowhere, was identified as a mediator. I don't know when was the last time Pakistan dealt in mediation. But Pakistan, because it brought the weight of the Muslim world behind this board, and of course, Trump communicates well with power, and he likes the generals, and so he turned a blind eye on all their history. And they've become his partners in peace, and now we are working together to deliver peace under the Board of Peace. And the last, I think, and I'll stop here, maybe I'll come back later, I don't want to take too much time, is the way we have started to conflate killing and peacemaking, simultaneously, that we can do both things without being questioned. And what worries me from a humanitarian perspective is that the humanitarian agencies, whether they like it or not, have become instruments in the hands of those powers operating within those fields. Partly because maybe of funding constraints, and more humanitarian agencies around the world have become dependent on on support coming from governments or UN agencies. Less and less are totally independent in their funding. And partly because we are really deeply concerned and we want to help and we want access. And you will only get access if you keep your mouth shut. So you need access, you need to keep quiet, you need to go in, you have to work, and so on. And the combination of these two have led us into a situation where we have accepted, in the name of helping others, we have accepted to be part of a very complex, I think, condition at the moment that ultimately is doing more harm than good. And it is very important, and I'm really, really pleased that we're having this conversation here at this moment in the Congress. It's very important to address this head-on and see what does it mean for us moving forward. Do we need to become more vocal? Do we need to ask for more pressure on our governments? Do we need to ask for more tax on weapons? I've been saying this for years, nobody agrees with it, but I still think those who made the 1% in the world, who made now billions over the last 3 years, they should be taxed. And that tax should come to the humanitarian because of the damage they're causing, very similar to the environmental tax that we have successfully imposed on some industries, including the air polluters around the world. If we continue to say, oh no, we're neutral, we don't do weapons, we don't talk about this, we're going to be totally irrelevant because they are going to continue in this way. And I'm afraid we are living in a world at the moment where power rules.
Thank you very much indeed. A really fantastic overview. And I think a number of threads in there that we want to pick up. I'm struck by your last point there. I think actually we heard a very similar point in the previous session from the chair, who was arguing that as the shift from overseas development assistance into defense budgets goes, that should include the costs of dealing with the consequences of war. I think it's a strong argument. And we'll come back to you, Sultan. I want to turn to you, Cordula. And really, I mean, the core mission of the ICRC, put simply, is to alleviate human suffering in conflict and uphold minimum standards of humanity without pursuing political interests. In the context we've been hearing about, what do you see as the greatest challenges that the ICRC faces in this mission today? Where are you struggling most, both on the ground and at the policy level?
Thank you very much. And first of all, thank you to the organizers, to the German Red Cross, our partners here in Geneva, in Germany, but also to all others for inviting us on this panel and to speak particularly also about indeed the international humanitarian law aspect of these conflicts. But you were asking what the greatest challenges are, and I think just to sort of set the scene and very much agreeing with Sultan in many of his points, particularly the description of conflicts, I think, first of all, to talk about the number of conflicts. So we are in a world at war, where no continent is spared wars, and the ICRC classifies conflicts based on legal criteria, and the number of conflicts has risen since the end of the Cold War. It is unprecedented. Now we have about 130 armed conflicts involving about 60 states. That's not all states in the world, but still it's millions and millions of people suffering the consequences of those conflicts. And lately what we've seen is also that we're not just talking about non-international armed conflicts anymore, civil wars, but very much as well about conflicts between states. And that is, I think, a significant trend. And what it shows, probably first of all, is the casualness of the resort to force between states, the casualness with which force seems to now be a way to solve disputes, and the breakdown, or at least a huge pressure on Article 2.4, the prohibition of the use of force of the UN Charter. And it starts, the UN Charter is the Grundnorm of all of us, before human rights, humanitarian law, etc. And that is under huge strain. And again, it has consequences for people. And this is, I think, what as humanitarians we're always, of course, most worried about. With that, it means, because of the number of conflicts, the violations are also exponentially growing. And the challenge here, if you ask me what's the biggest challenge to international humanitarian law and the mission of the ICRC, which seeks to convince parties to uphold international humanitarian, has always been the discrepancy between the norm and what is on the ground. You said yourself at the beginning, Freddie, international humanitarian law has always failed to deliver for far too many people, even though it has also protected thousands and thousands of lives. Both of these things are true, but it's just not good enough that it has protected thousands and thousands of lives. We want it to deliver even more and to protect more people. Third aspect of this new challenge is, I think, a real risk of the normalization of total war. We have, when you look at the big conflicts, perhaps I'll still include Syria, because Syria, I think, was in a way a very significant conflict in terms of the trends. Russia, Ukraine, Israel, Gaza, now Lebanon, Iran, Sudan, the big conflicts that we think about, forgetting about all these other conflicts that we should be thinking about: Myanmar, Afghanistan, Colombia, South Sudan, DRC, which also cost millions of lives. Look at the characteristics of these conflicts. Huge numbers, unprecedented numbers, not unprecedented, but sort of in recent times, unprecedented numbers of death and wounded. Biggest numbers of displaced persons internally, as well as refugees, that we've ever had since the Second World War. I think extremely characteristic of these conflicts is the attacks and complete destruction of civilian infrastructure. We saw that in Syria. In Syria, water became a weapon of war, if I can say it in a very non-legalistic term, and you see this now in all these recent conflicts. I mean, the first thing that you see is just attacks on civilian infrastructure, and this is not about objects, it's about essential services to human beings. It's about being able to deliver food and water, medical care, the basics to people. And this is really an aspect, I think, of total war, of total destruction, of everything that the enemy relies on. Also something that Sultan talked about, the dehumanization of the enemy, which we saw so starkly as well in Syria, we see in South Sudan, in other places, Myanmar. The dehumanization of the enemy, which we as ICRC, who are very much involved, of course, in detention, see very much as well in the treatment of people who are caught in detention, the mistreatment, the lack of basic care, the incommunicado detention, the impossibility of families to know the fate of their loved ones, the huge numbers of missing persons. They augment in our database of the ICRC every year. The exponential power of technology, and we saw that just a couple of 4 weeks ago again in Iran, with artificial intelligence making its way into targeting. We see it in the autonomy, the increasing autonomy of weapon systems, where basically we are now also deciding to keep the human out of control of conflicts with an absolutely sanitized discourse that the future of conflict will be machines fighting machines. Well, that would actually be great, you know? I would love that if machines were fighting machines. The fact is that war is about killing people, and technology in the battlefield will just lead to death and injury as well. And if you look at all the conflicts that I cited, you can see that. Another characteristic are the attacks on humanitarian personnel and medical personnel, not just collateral, but deliberate attacks on this. We at the Red Cross, Red Crescent movement have lost many people in the past years. The worst has been in the Sudanese context, but also, of course, Gaza. Now already in the Iranian conflict, in the conflict involving Iran, has already claimed the lives of some colleagues of the Iranian Red Crescent and the Lebanese Red Cross, as you know, who are always heroically, really heroically on the front line trying to help people, are paying this with their lives. So I think when I say total war, it's really because the core tenet of international humanitarian law, which all states have signed up to, is that war is meant to affect the military might of the enemy, and all of international humanitarian law is about sparing civilians from the hostilities. And this has been completely turned on its head with the wars as they are fought today. And against this, and I mentioned this background, and I know it's a factual thing, it's not a legalistic point, but I think it's so important to always say this is what international humanitarian law is about. Is when we talk about international humanitarian law, we have to keep this in mind. And against this background, we have a paradox, which is that never has international law been so much, I think, on the minds of states, and in that I would actually disagree with Hans-Jörg. It depends what you mean by no one cares. It is invoked all the time. Never have we had so many cases in the docks of the International Court of Justice. Never have we had so much activity of the International Criminal Court. Never have we had so many cases of universal jurisdiction where actually war criminals are being prosecuted. We even have first cases now of companies involved in conflicts being brought before courts. And this, I think, is very good, and it shows that international law still has a very huge, not only legal, but also moral force. It matters that international law is violated or not, and this we have to hold on to. This is important. But the paradox that it leads to is that states at the same time are all saying all the time that they are abiding by international law. And so they are justifying the unjustifiable under that body of law, which means that by their interpretation, they are completely hollowing out the norms and turning them on their head. And that is coupled with two things that make it even worse. One is the selective invocation of international humanitarian law, and no state is spared from its double standards invocation of international humanitarian law, which is an extra strain on the corrosive effect. And this to me is, I think, something that I'm thinking about more now. I don't know if it's always been so stark. It seems to me, but I don't have no evidence for it, that it is starker is the silence in the face of these violations and of these justifications. That is, there is a legal argument to be made to say, we could completely destroy this hospital. This water infrastructure is a military, we are justified in targeting these, electricity plants and so on. And the silence is deafening in the face of it. And this, I think, is where I think we'll have a second round where we'll talk about what do we need to do. But just to introduce that, I think we need to come back to the core tenet, to the object and purpose of international humanitarian law, and remember that behind the norms are values, and we need to go back to those.
Thank you very much indeed. It's a sobering assessment. And I think there's a common thread that I'd like to pick up with what Sultan was saying also about silence and speaking out. And I think that's a big challenge for humanitarian actors. But I'd like to turn to you, Dr. Fatou. Without the promise of accountability and justice, humanitarian assistance risks being just a fig leaf. From your perspective, at the ICC, how do you understand the attacks on humanitarian principles in IHL and what it means for both humanitarian and legal actors? How did you see this evolving when you were at the ICC, and how do you think things have changed in the last few years?
Thank you very much. Of course, I want to thank the organizers for inviting me to come. I'm very pleased to be here. But thank you for your question. I think the concern that is reflected in that question goes to the heart of the present moment. Humanitarian action is, of course, indispensable because it seeks to preserve life and to alleviate suffering and uphold a minimum of human dignity in circumstances of extreme violence. But humanitarian action alone cannot and should never be expected to carry the entire burden of moral and legal order on its own. It is not a substitute for accountability. It is not a substitute for legal restraint. And it is certainly not a substitute for justice. So when one says that without the promise of accountability, humanitarian action risks becoming only a fig leaf, I understand that as a warning against allowing relief efforts to stand in place of responsibility. Humanitarian actors may save lives, and they do save lives, and that work, the work that they do, is, of course, indispensable. But if the legal and the moral framework that should restrain conduct is steadily weakened, then humanitarian action risks being left to respond to the consequences of abuse without any corresponding insistence that such abuse must answer to the law. My perspective is that the attack on international humanitarian law and on humanitarian principles today is troubling, not only because violence occurs, but also violators of law in armed conflict are, unfortunately and regrettably, they are not new. What is especially troubling is that the authority of the norms themselves appear increasingly strained. We are seeing not merely breaches, but a more profound challenge to the seriousness with which the rules are regarded, in which the rules are defended and applied. And in some quarters, principles that should remain universal are treated as though their force depends on circumstance, or that it depends on interest or political alignment. And that is deeply damaging development, because the strength of humanitarian law lies precisely in the fact that it is not meant to be conditional. For humanitarian agencies, the implications are immediate and they're practical. Their work depends upon a minimum recognition that there are limits in war, that civilians and those no longer participating in the hostilities are entitled to protection, and that humanitarian assistance must not be obstructed arbitrarily. When respect for these principles erodes, the operational space for humanitarian work becomes narrower and more uncertain, and access may become harder to secure. Neutrality may be more readily questioned, and the legitimacy of humanitarian action may become under pressure from actors who themselves insufficiently committed to the principled restraint. So in such circumstances, humanitarian agencies are asked to work in environments where the normative ground beneath them have become less stable. So for legal actors, the implications are different in form, but no less serious in consequence. The law depends not only on the existence of rules and institutions, but on confidence in their credibility, consistency, and their impartial application. If legal principle is treated as negotiable, or if accountability appears uneven in its force, then trust in the integrity of the system is definitely weakened. And that affects not only the institutions, but also victims and affected communities, for whom the meaning of justice depends in part on whether they are reasonably believed that law remains more than mere form of rhetoric. I would also say that humanitarian actors and legal actors should not be seen as occupying wholly separate spheres of concern. Their mandates are, of course, distinct, we all know that, and their methods are also distinct, but they are connected in a common underlying premise, and that premise is that human dignity must remain protected even in the midst of war, and that there are limits beyond which conduct cannot be normalized. Humanitarian action responds to immediate suffering, and legal accountability addresses responsibility, recognition, and the preservation of principle over time. So one should not ask to replace one with the other. As to how this attack has evolved in recent years, I would put it in very careful terms. The pressure on these norms has become more visible and has become more sustained. And in some settings, it is even more difficult to counter with a common language of restraint. The cumulative effect of repeated crises is that erosion can now even begin to appear as normal, ordinary. And that is one of the great dangers of the present moment. Not only that norms are violated, but that repeated strain can dull the sense of urgency with which violations ought to be met. And once that happens, the decline is no longer merely operational or legal. It becomes moral as well. And that is why clarity is important. Humanitarian action and accountability must not be treated as alternatives. It's together. And they serve different, but they also serve complementary purposes. Humanitarian action responds to immediate human need, and accountability affirms that grave harm is neither invisible nor consequence-free. If the protection of human dignity is to remain credible, then both of them must be defended.
Thank you very much indeed. And I'd like to come back later to that question of complementarity and how that can work in practice. But finally, Dr. Lina, this conversation, Geneva looms large in this conversation, as does New York and the Security Council. And sometimes it feels like a very Western-dominated discussion. How do key power brokers in the Asia-Pacific region understand these debates and these dynamics? And how different do they feel and look from where you sit than where we often tend to come at this from as humanitarians?
Thanks, Freddie. First of all, I'd like to thank the organizer for having me. And it's really a great pleasure to join this very important and timely discussion. Yesterday, I was joking with Freddie that I saw not many Asian faces here. I guess even fewer Chinese faces. And I know the mention of China's role in this type of work can trigger a lot of discussion, debates, etc. Well, I myself I'm not very good at dealing with this kind of controversies or debates. So I had a safe solution is to focus on maybe my Southeast Asian experience, to talk about disasters there and how people responded to disasters. But unfortunately, I found Ibu Adlina and a few other Southeast Asian colleagues as speakers, and then I realized I don't have a safer choice. I have to touch on the more controversial, I wouldn't say controversial, unknown or less known player in this space. And then I have a thought. Actually, I have experience or some perspective to offer. As a Chinese who work and stay in Southeast Asia for a long time, really a very long time, who read a lot about academic and policy publications about humanitarian work or crisis-related issues or debates, I feel I generally understand the discourse. On the other hand, as a Chinese, I naturally read and hear about what happened in China. So I feel I have an interesting combination to shape my perspective or my unique lens. Of course, I can't represent anyone, but I still have my 2 cents to contribute to this discussion. First of all, with regard to perspective about the debates going on in the world, in Geneva, in New York. I would say, first of all, that the care for people, the awareness or the moral understanding to alleviate people's suffering. I believe this is universal. Every culture has that. It's I believe it's our human nature. With regard to humanitarian law, as my distinguished panelists mentioned, this is also what mentioned by the Chinese government officials during their remarks at different occasions. Recently, China, together with Brazil and a few other countries, had this global initiative to galvanize political commitment to international humanitarian law. So there is this commitment to uphold IHL, I believe not just from China, but other Asian or Southeast Asian countries as well. And then a third point I notice is that the relevance of the multilateral system in the discussion related to humanitarian response. it's repeated or stated by the Chinese government and officials. And in practice, humanitarian or multilateral humanitarian system is also what the Chinese government goes to when they need to respond or get involved in more complex situations where they are not so comfortable with or not having enough experience yet. Here I refer to like conflict situations. And then a third point I notice is about their focus on addressing what they often call the root causes of all these crises. And from their perspective, whether we agree with it or not, it's a lack of development. So focusing a lot on economic development, provision of livelihoods, it's not just their rhetoric. This is what also they do domestically. So solving people's immediate needs. Of course, rights, then there is a different interpretation of rights. I will talk about it later. And then another point, very interesting point I noticed is that discussion here focus a lot on conflict situations, which is rightly so, given that the regions facing conflict-induced humanitarian challenges are so near to Europe or this part of the world. Well, in the Asia-Pacific, the picture is a little different. Of course, there is a violence there, communal violence or domestic violence. But overall, that region has witnessed relative peace. So the discussion related to humanitarian response is more focusing on climate change or respond to disasters. Just 1 or 2 weeks ago, actually, there is a national forum within China about reducing climate-induced risks. And then they have a forum specifically focusing on how to make their social response or non-governmental response group more professional. And then how to make their response more technologically enabled. So as you can see, that the discussion within China is quite different from what we are talking about here today, because the context is different, so it's naturally different. And then I will also say the social context or the soil is different. So you can't expect the same kind of mindset or mentality. So the first very important difference is who are humanitarian actors. The state, of course, is political in a very strict sense. They are not humanitarian actors, but they are important players or actors when we respond to disasters. In Chinese context, at least. Yesterday, the German Red Cross colleague Christoph Jonen, right? He mentioned when you talk about German people in times of disasters, they will immediately associate with like Caritas or these or NGOs or religious group. So at that time, the first idea come to my mind was if I talk about this or mention disaster to Chinese people, at least the majority of them, what kind of actors will come up in my mind? For example, my parents. So who is the first actor they will associate with? My answer is the government. This is true. They have this, they call it community office, which is of course affiliated with government. They will go to people in need, vulnerable groups for what they need, and then how they can help them. And the second, in times of disaster, you will often see images about the PLA soldiers carrying people across floods and helping them out of infrastructure, buildings in danger, etc. So this is how they see response to disasters. And then the second one is the rights to, what are human rights? So in the Chinese discourse, they often, or they always emphasize these rights to development, to livelihoods. Without life, without food, without all these essential needs being satisfied. So what's the point about talking something else? For example, political rights, civil rights, etc. It's not saying that these are not important, but they prioritize, or there is a list of priorities. And then that's also explain why Chinese aid is often like infrastructure focusing. And another very important, interesting difference I noticed, it doesn't mean that which one is better or which one is worse, but then the balance or the relationship between individual needs or individual rights and collective goods. The example I associate with is the Chinese response to COVID-19. Nowadays, we don't mention or talk about it a lot anymore. However, at that time, for a considerable period of time, there were very strict restrictions. And then it did cause a lot of inconvenience at some point of the 3 or 4 years course. However, the many senior citizens or vulnerable people with very serious health issues survive that crisis. For example, for my parents who are in their 70s, they didn't really feel the impact of the pandemic until it went to the very last maybe few weeks. Most of the time, they were able to move freely and they didn't get COVID until I believe end of 2022 or 2023 when it's about to open up. So that's the difference. And then the third one is whether disaster response or humanitarian response is a technical issue or it's a normative issue. So I feel in that context, they often, in Chinese discussion, they focus more on the technical aspect rather than involving in the normative debates. And then regardless of the differences I mentioned, I would also like to highlight that China is not so different in some respect. For example, in recent years, they established aid agency, which is similar to GIZ in Germany and a few other countries. And then they have Red Cross, and then they have growingly active social groups, that's what they call, or non-governmental response groups. They responded to disasters overseas, and they have become more coordinated, more professional over the years. If you compare 2015, when they responded to Nepal earthquake, to the Turkey earthquake a few years ago, they have become more coordinated and more professional. So there are these kind of groups, very active there, responding to disasters, but not engaging in the policy debate yet. And then there is a small but growing community of academics. And then young people are increasingly aware of the discussion, although not in a very big group, but there is this dynamics going on within China. Yeah, thanks.
Thank you very much indeed. And I thank you for going to a more uncomfortable place. And I'd like to pick up in a moment on some of those sort of changes that you flagged at the end there. But I just want to give us a chance to come back to this question of what do we do? Can this race towards a kind of pretty stark picture of a collapse in norms be stopped? How? And what should the humanitarian sector do about it? I think there are threads in everything that you've said so far, so hopefully we can pick up on some of those. So starting with you, Sultan, where do you see opportunities? If we're in a more, one of the things we hear a lot about is that we're in a more transactional age. And in a more politically negotiated system, a more explicitly politically negotiated, is there room for more honesty? Is there room to close this gap that Cordula spoke about between rhetoric and reality? Do you see spaces where humanitarians can be more proactive?
I was most hopeful when we started the discussion about regionalism and localism, on localization, and I did some of those reflections and writings about localization at the time. But I'm a little bit disappointed, I think, at the moment in the way we implemented the agenda and we pushed it forward. Again, focusing on the practicality and the financial side and not addressing the normative and what these people should really be doing for themselves and how you can strengthen organizations within the country and so on. But maybe still the hope is to do so, is to expect everyone to be the first responder within their own context, be it in Europe, in America, in the Middle East, and so on. And if I were to maybe look at it from a Middle Eastern perspective, I think where we are not doing enough is in picking our own responsibility within the Middle East, within the Arab states in particular, to respond to crises that we face. We're very good to mobilize when the United States says mobilize, or when they give us something attractive to follow, but we're not good to mobilize around a humanitarian agenda. And despite the limited progress that has happened in terms of engaging in the debate about humanitarianism and so on in the Arab world, and as you know, I set up the center in Doha, Center for Conflict and Humanitarian Studies, a few years ago. It was the first center ever to be able to speak publicly about these issues. We still have a lot to do. We need to work on designing regional instruments and legal instruments, practical and so on, where we can keep our problems within our boundaries and pick up our responsibility towards them, and not use our problems as a pressure against our neighbors, be it in Europe or elsewhere. Because what that did is alienated a lot of what could have been goodwill support coming from Europe. It's become strategic support. And we saw that in Syria. Either you give us money or we'll push more Syrians towards you, be it the Turkish government at the time or the Syrian government, Assad and so on. That does not help. We must understand that we're all in this globe. We're not going to go anywhere. And we have to look after our neighbors and hinterlands and integrate with them as much as possible. So I would say for our regional perspective, we need to start working on our own instruments. And we need to use our own mechanisms for our own benefit first. For example, zakat money. Now it's very attractive amongst the UN agencies. Everybody has set up a zakat fund. They want to milk the possibility of religious Muslim people giving money, but under their control. Well, why can't they give their people directly? And the most important obstacle is where I started, is the lack of trust, is the dehumanization of these communities, is the fact that we think we really ought to take their money off them, but we decide how we can spread this money, and we have to use the dollar finance transitional channels. Therefore, it has to be all 100% kosher before it gets to anybody. That defeats the purpose of an immediate response where the need exists. And I don't know enough about the situation in China, but I think in our societies everywhere there is this sort of immediate community arrangement where people respond at the first stage. But they lack resources, they lack coordination, they lack these instruments that they need to work around. So I see that as one area where we can develop. We pick up more responsibility for ourselves, and the price is going to be high regardless, whether we do it ourselves or we wait for somebody else to do it for us who will arrive too late, will cause a lot of problems, will leave a lot of unwanted, impossible to recycle material, all sorts of issues that you probably all know about major relief efforts. So that would be, I think, number one.
Briefly.
And now, on the opposite side, and I think particularly within Europe, and I was very encouraged in recent steps taken by European countries distancing themselves from those who are spoiling the international order, or some of them at least, is that we need to put more pressure on politicians. And I think we need to be less shy of speaking the truth where it matters. Either we do it, all of us together, or if we're going to specialize, so say agency A and agency B is about reaction and access, then we should all collectively support agency Z when they speak out. But the way it is now happening haphazard and, you know, we don't really work collectively, does not help. So I think there is space for that, including building more and more trust between Middle Eastern agencies that are becoming more and more important. And very importantly, some of them are becoming more and more independent. If you look at Turkish IHH, I don't know if you're familiar with it, I don't know the exact name for it in Turkish, but it's probably one of the few organizations in the world that works with huge budgets, totally raised out of individuals, membership of Turkish civilians, you know, businesses, local business. They don't take a penny of their government. Now that model is now eroding in the West, and I think we need to try and capture it back again.
Fantastic. Thank you so much, Sultan. Cordula, if I can turn to you, that we've actually already heard, I think, Dr. Lina mentioned the global initiative on AHL that the ICRC has been putting together. And I wonder if you can reflect on the global initiative, what it's trying to achieve, particularly politically, and how it might be a model for the kind of actions that humanitarian actors can be taking in the face of these challenges.
Yeah, and I think the premise here and the starting point for us is that, you know, at the end of the day, if we want to reduce the suffering of people from armed conflicts, first of all, we need to work much more on peace. And second, we need to put the responsibility back on states and parties to conflicts. It's their obligation to protect civilians and to spare civilians from the fightings. It's not the obligation of humanitarian actors. And I think the initiative starting point is really that it is states' responsibility to come back to an attitude of better respect for international humanitarian law. And that responsibility at the multilateral level has to go through a political commitment. It cannot be left to lawyers or humanitarians. A bit in the sense of what you were just saying about holding politicians to account. I wouldn't perhaps, so it's not so much about perhaps politicians as such, but it's the political level of states. And so, and it has to be universal. It can't just be, you know, 2 or 3 states trying to uphold international humanitarian law, and with, you know, with all the admiration I have for efforts of states like Norway or Switzerland, it's just not sufficient. International humanitarian law belongs to everyone. And so we started an initiative with 6 states around the world that are not representative, of course, of their regions, but to symbolize the fact that we need to have a multiplicity of states launching this initiative and then joining the initiative. And so the 6 states were Brazil, China, that you just mentioned, Jordan, Kazakhstan, South Africa, and France. And these 6 states, interestingly, immediately said, yes, this is what we need to do, invited all states to join this initiative. And the initiative has a terrible title, I have to confess. It's called the Global Initiative to Galvanize Political Commitment for International Humanitarian Law. So it's a horrible title, but the point is the political commitment part of it. This is not about having discussions about you know, technical issues. It is also about technical issues, but it is about galvanizing political commitment. We have now, and the initiative is, in terms of substance, around 7 work streams. 3 of which are very much about what ultimately will change respect for international humanitarian law, which is preventive action. We need prevention, prevention, prevention. It starts at home. We need training of the armed forces. We need national implementation of the Geneva Conventions, and so on and so forth. And then we have 4 work streams that are really about the big issues, or some of the big challenges. There are others, but we need to make choices, basically, of contemporary armed conflicts. The protection of hospitals, the protection of civilian infrastructure, the use of information and communication technologies in armed conflicts, and naval warfare. And when we launched the initiative a year and a half ago, some people said to us, naval warfare sounds a bit niche. Well, it isn't. So we now have over 100 states that have joined the initiative. The last one was Mauritania, I think, a couple of days ago. So we have over 100 states that have formally joined the initiative, which is amazing. And we have, for each of these work streams, we have altogether 27 co-chairs. So it's really not an ICRC technical initiative. It belongs to states. It was launched by states. It belongs to states. Because, again, it is their responsibility. And we've had state consultations on these work streams with recommendations, practical recommendations on how can we improve respect. And we've had over 150 states coming together. And I think the specificity of the initiative is in the process. Because it was sort of incentivized by the ICRC, we followed the non-political, non-contextual way of doing it. And we said to states, we understand you all have your conflicts and your violations that you are particularly worried about, and you want to call out the violations committed by your enemies or the friends of your enemies, etc. This is not what this initiative is about. We all know what we're talking about, but we can come together, we have to come together as international community to talk about our understanding, and you have to speak out about your understanding of what it means to protect hospitals, your understandings that civilian infrastructure is not military infrastructure and cannot be targeted in a non-politicized and non-contextual way. Everyone will understand what you're talking about, but it makes it much easier. And it's quite a unique forum where we've had over 150 states really engaging in it. I've never seen so many states express very serious, very sophisticated views on international humanitarian law. And that makes a body of state pronunciations that are really, when you look at them in their great majority, very protective. This is what we have to build on. It will culminate at the end of 2026, probably December 2026, in a high-level meeting in Jordan, hosted by the 6 founding states, of course hosted by Jordan with the 6 founding states, inviting all states to come together to reaffirm this political commitment to international humanitarian law and to change the course of conflicts as they are now. So all states are invited to come at the highest level and to make that commitment clear.
Thank you very much indeed. And I think in the context we're talking about, it's an extremely important initiative, and just the fact of bringing these states together is critical. Of course, we come back to the gap, and the gap around accountability. And Fatou, you spoke, I think, very powerfully about the need for legal actors and humanitarians to see themselves as complementary and work together. I was part of conversations yesterday afternoon here, and this is something that I know is in the wider discourse, a lot of concern around neutrality, around how do humanitarians navigate that space. What would be your reflections on recognizing this is not humanitarians' responsibility, but what can humanitarians do more to play that role in driving accountability, and what would you like to see humanitarian actors stepping up to do more of?
Thank you very much for that. Of course, as I said in my initial response about humanitarian action and law complementing each other. But I think that at the moment, what is more on people's minds is that whether we believe that actually law can shape power. This is something that really it's on everybody's mind because of what currently is going on. And I'm not being an optimist, but I do think that law can still shape power. And we should work on that. But I also say that with realism and not with illusion, because we all know that law has always never operated in a world that is free from politics or unequal influence or even strategic interest. So, and the interaction between law and power has always been complex. So the real question, in my view, is not whether power affects the environment in which law operates, because it clearly does. We have seen that now in everything that is happening around us. And the deeper question is whether we are prepared to accept that power should define the final limit of what is lawful and what is legitimate, as well as what is accountable, what it requires. And I do not believe that we should accept that. I continue to believe that law can shape power, because law does something that power alone cannot legitimately do. Law establishes standards that are meant to apply beyond convenience. It distinguishes between force and legality. It provides a framework within which conduct may be judged, obligations identified, and the violations that are done, we see it named. And it preserves the principle that even in circumstances of armed conflict or political intensity, there remains limits that are not meant to dissolve merely because they are inconvenient to the powerful. So law, for me, shapes power by shaping legitimacy. So even where compliance is contested and legal standards still matter, because they help define what can properly be defended and what cannot, they compel the actors, they compel states, and they compel institutions to situate themselves in relation to norms that they cannot simply erase by assertion. So in that sense, I believe that law remains a form of restraint, not only in the narrow judicial sense, but in a broader moral and political sense as well. So therefore, I will say it matters because it provides the language of responsibility. And without law, grave wrongs risks being reduced to competing narratives or even political claims or the language of necessity. I think today we are seeing that happening a lot. And law insists on something more rigorous. It insists that there are duties, that there are standards, that there are consequences, and that the suffering of victims is not to be treated merely as an unfortunate byproduct of events beyond scrutiny. I'm depending on law because I still think that even with humanitarian work, the law, of course, is still very, very relevant. But at the same time, one has to be candid, because power can and does pressure the legal order. And currently, we are seeing that happening, even at the ICC. It has happened before. As you know, I was sanctioned during my time, but it is happening now. And today, you find that I think about 9 staff of the ICC, 8 or 9 staff, have already been sanctioned. So it can influence the conditions in which law is interpreted, or is defended and is enforced. It can expose inconsistencies, and it can test also institutional independence. It can exploit the weakness where consistency is lacking. And when legal principles appear to be defended unevenly, and I put emphasis on unevenly, the authority of the system is undeniably weakened. And this is not a trivial concern. I believe this is one of the central challenges of our time today. So, but acknowledging that reality is not the same as conceding that law has ceased to matter. Nor is it the same as accepting that power has replaced law altogether. In my view, that would be too absolute a conclusion, and it would surrender too much. So the fact that law is challenged does not render it meaningless. On the contrary, it demonstrates why the defense of legal principle remains very necessary. And perhaps maybe the better way to understand the present moment is to say that power continues to test the resilience of law. It may distort the conditions in which law operates. It may even reveal the weakness in enforcement or inconsistency. But the answer to that cannot be withdrawal from legal principle. We cannot do that. It must be greater seriousness in defending it. It must be greater consistency in its application. And it must be a refusal to allow convenience to become the measure of legality. So my answer is this. Law still does shape power, though not automatically and not without contest. But it does so by setting standards, by preserving the distinction between force and legitimacy, by affirming that the powerful are not beyond legal scrutiny, and by keeping alive the principle that human dignity is not contingent upon political advantage. Power may test the law, certainly, but it should not be permitted to define justice.
Thank you very much indeed. So finally, Lena, and I do want to give a chance for a couple of people to come in with questions, but just to kind of pick up where I think you left off, talking about some of the similarities between the Chinese context and elsewhere. And I think if we're moving out of a period of Pax Americana, however we might understand that term, and however we might understand the future, but for those who are asking the question at least, how will China see their role in shaping a new order, if there is to be one? What would you, where do you think there may be opportunities or fruitful areas of discussion to be had with actors in China or around the Chinese context?
I can see that there has been a lot of discussion about China's expanding role or expectation to see China plays a greater role. And on the other hand, the reality is that they are still not so familiar with responses to conflict situations. Of course, they offer aid, emergency relief items through bilateral and multilateral mechanisms, etc. However, overall, you'll see their responses to natural disasters or natural hazards have been more developed or more mature. So I guess that the next step to inform or encourage a greater role of China in more complex situations, I guess first of all, sustained communication through multiple channels or at different levels are necessary. Of course, dealing with ministries it's not easy. I guess it's the same. It applies to governments everywhere. It's not easy. So a bottom-up approach would help to build these awareness. Actually, this morning, I talked to another participant about the development of area studies within China's academic circle. So it bears some similarity. I noticed that area studies in Europe started maybe 100 or even 200 years ago when they became curious about the nearby adjacent regions. So they have scholars going to Middle East and Africa to understand that part of the world. Of course, it's related to interest. And then during the Cold War, you see the thriving of area studies in the United States and USSR, and it's also driven by strategic interests. And then for China, of course, there have been studies on area, other regions, but it's never been given a quite important role. However, in past 5 or 6 years, this discipline has been elevated to the first degree discipline within the Chinese education system. It shows its importance. So while the studies of development or humanitarian issues there has not been there yet, it will take a long time. But there is a tiny community or growing community there. So I guess interaction can start from there, and they have channels to have conversation or inform their policymakers. And there is this school called International Academy of Red Cross within Suzhou, and then there are academics there, and there are some ministry-affiliated think tanks who started working on development aid, humanitarian aid issues a few years or about some time ago. So there is this community growing. Actually, yesterday or the day before, there was an event about humanitarian, or how to reset the humanitarian system. So I think it's very important to have more international actors to share their perspective, to engage or encourage a greater role. And on the other hand, it takes an organization like IFRC, this initiative about IHL, to demonstrate that there is opportunity or time for other non-Western countries to shape a new type or set of principles or norms, and that fit for the context of nowadays. Because the previous rules, norms worked for some period of time. However, obviously the context has changed. So it's important to demonstrate these non-Western countries that now is the time for them to speak out. Otherwise, then the rules will be set again without their voices reflected. Yeah, thank you.
Thank you. I think that's a really important point to end on. Okay, so we have a little bit of time left in the session. So I just want to open it up, really. I'm sure there are a lot of thoughts. I think we only have time for a couple. I'll ask you to keep it brief so that we can hear from others. I don't know if I can see some hands over here. Maybe, I don't know, the gentleman, yeah, closest to you. Exactly. And then maybe behind after. We'll see how we do.
All right, thank you very much. My name is Jeff. I'm a meal specialist and a NOHA alumni. And thank you very much for all the very insightful thoughts you've shared. I wrote my question down, so I'll just read from here. So I think Dr. Cordola, you mentioned something along the lines of organizations coming together to make a commitment. And however, we know that the enforceability of international humanitarian and human rights law has always been a challenge and an issue, perhaps even a gap or a loophole. And so what guarantees are there that these states will not just make these commitments for the uptakes and still go about violating them? And because in some cases you only have some representatives of these countries attending these meetings and making these commitments, and while they may represent the interest of their countries, it can be challenging to ensure that the commitments they make are agreed at the highest levels in the country. So there's probably no clear or direct answer to this, but it would be great to know what conversations are happening or going on along these lines. Thank you.
Fantastic, thank you. And then one behind.
Okay, thank you. So thank you for all your presentation today. I'm really glad to hear that so many different perspectives. And I'm a Chinese student who's nowadays studying in humanitarian action. So probably my question is especially for Dr. Lina Gong. So as someone who shared like the similar background with you, I believe and with my other Chinese colleagues, we are really proud to see your participation here today. But just like when you mentioned about these COVID-19 policies in China, like as what we discussed with my other Chinese colleagues, I believe these policies are really different from different regions. So I just want to add one point that sometimes we probably should keep that diversity in policies in mind. And I'm curious whether there's sometimes a risk that avoiding controversy might also limit how deeply we engage with structural injustice in humanitarian work. Thank you.
Thank you. And maybe we can have one more. I want to look to this side of the room, but okay, we have one here.
Good morning, everyone. I have a question for my friend Linago. It's about China again. I had a question yesterday about exercising the leverage when dealing with China. And of course, as you know, ASEAN, I come from ASEAN, we have that leverage when dealing with China as well as other dialogue partners. You mentioned that when it comes to rights, Chinese government in particular would frame it more as economic and development rights, while the Western understanding of rights would be different from what the Chinese would feel. Do you think that, have you seen backlash over these differences? And how do we reconcile other human rights issues, such as, I know that this may be a very uncomfortable question, but you know that there are also violations of human rights in China, pointed out by the UN against Muslims in China. While you mentioned that rights are universal, how would the Chinese government see this? Are they seeing it more as a security and a stability issue rather than the basic human rights issue? Thank you.
Thank you very much. Okay, so maybe we can work backwards along the panel. And I think a question there around enforceability of IHL and how to close this gap. I think a question there around maintaining and recognizing diversity in policy and how to manage that moving forwards. And then also, I think a couple of issues there around being willing to engage on controversial issues. And I think a quite specific question there about the context of human rights and how human rights is understood and engaged with in China. But maybe I can ask you to provide any thoughts on those questions or any other reflections before we close for lunch, starting with you, Lina.
I thank you for the questions, and I'm very glad to know that there are Chinese students which are in the audience, which actually represent a growing interest or awareness of this conversation among the Chinese population. And I totally agree that policies need to actually reflect the social context, and it's different societies have different norms, different rules, and each will make their own choices. And also it is important to recognize that no policy will be perfect. And then with regard to Lina's avoiding controversies will actually reinforcing systemic injustice. So I feel that's why I feel necessary to engage in an open discussion, recognizing the differences, and also in a word I find very interesting is positionality in social science study. So everyone has their unique lens. You can't avoid it. What's more important is be transparent about the differences, and second, respect the differences, and then find mitigating measures. Each side need to make some compromises. But then if we start by accusing or criticizing or demonizing or having a strong bias, then it will be very difficult to really have a frank, constructive discussion and then to really benefit the system. Now, with regard to Ibu Adlina's question, I am not an expert on that issue. Then I feel it is very important to verify. So what are the truths, and then what are the reported stories? So that's my initial response to that point. And I feel criticisms each government face that. So as mentioned earlier, like frank, honest conversation is a useful, helpful first step. Yeah, thanks.
Thank you very much indeed. Fatou.
I did not have a question as such, but I probably just want to say that international law will continue to be tested. There will be pushback all the time. And even if you look at history, you find out that most of the time that we've come up with all these big conventions and treaties is because something very serious had happened, and we come up with a convention. So I believe what we need to do at the moment is to recommit. We really need to recommit to the rules. We cannot say what your friend said yesterday about nobody gives a damn, and I just align myself with what you said, that we do give a damn. And indeed. And you find that when, for instance, an international criminal court arrest warrant is issued, you find those who are targeted avoiding places where they know they will be arrested. We have seen that. So it matters. Of course, people will say, I don't care, I will not do that, but they know at the end of the day, international law will play its role. So those of us who really want to see a just world, a more just world, we need to recommit. We need to recommit to the principles, because at the end of the day, what it's really saying is that every one of us has the right to dignity, to peace, to justice, and to accountability.
Thank you very much indeed. Kodla.
Hardly anything to add to this, I would say. But I do want to come back on this question of enforceability, compliance, which is the question of all international law, and in particular about international humanitarian law, because it matters so much to the lives of people, and it's a life and death decision. And the first thing to be able to live with is that there is no silver bullet of compliance. There will not be a switch, click on, click off. We find the silver bullet. If there was a silver bullet, we would have already found it. And so to go back to this recommitment, and there's one very important article which is common to the 4 Geneva Conventions. It's common Article 1 to the 4 Geneva Conventions, and it says that all parties, all high contracting parties, commit themselves to respect and ensure respect for international humanitarian law in all circumstances. And this means not only to respect international law in your own jurisdiction, which is the starting point, IHL starts at home, but also to ensure respect by all states and all parties to all armed conflicts around the world. It's what in international law we call erga omnes obligations, which means these are obligations that are owed to the international community as a whole, because they are so fundamental to the entire international community. And the International Court of Justice and others have repeated in several cases that this entails a responsibility of all states to bring those who are in violation of international humanitarian law back to an attitude of international humanitarian law. It requires all states to use their leverage, to use the influence that they have, and of course the influence varies depending on circumstances and depending on the relations that you have with the state. But the more economic leverage you have, the more military cooperation you have, the more weapons you ship to a party to a conflict, the higher your responsibility to also ensure that that party to the conflict complies with international humanitarian law. And I think this is something that we need to take far more seriously and that all states in the world can contribute to, not just the parties to the conflict. So, yeah, thank you.
Thank you.
Well, I think we need to do better documentation of all the violations of IHL, and to do it as be part of our daily work and not worry about submitting those cases to courts and so on. I know this is a controversial issue for humanitarian agencies, but if you're there and you part of your added value is you are a witness, and people look up to you in that way, and as well as a protector. So if you witness and you're not able to document, then you're not really doing your job as a humanitarian, I think. The second one is we need to name and shame states and individual leaders when they go wrong. I think the most dangerous is to keep talking about all states and to try and generalize the harm that is being done. So you take some of the UN, and without mentioning any particular agency, they'd say there has been so many violations of human rights, or so many people, so many aid workers have been killed. But when you look at it really, there has been a particular state that has killed so many individuals, and in the most horrible, violent way. And we need to have the courage to say it and name it and shame it, so that those who have developed the habit of crossing the law do not go as far as sanctioning the institutions that are there to implement the law and to deliver justice. And finally, I think we need to worry about the poking of the dragon that is going on around the world. I think what is happening at the moment, trying to get China out of its comfort zone to be part of the wider politics, is extremely dangerous. This last war we're now living with Iran has nothing to do with Iran and the threat, the imminent threat, as you know, that Iran has posed to the United States or the West and so on. It is a lot to do with, obviously, Israel's agenda, but also to try and poke China, to get them to react and do more things. It started with the bombing of Nigeria first, then Venezuela oil, and now the Iranian oil. And we're waiting to see how far we can test their patience, their strategic patience. And I worry about that. Not for anything against the Chinese, except the fact that it's 1/5 of the world. And although we can criticize a lot of the humanitarian response within the country, we cannot deny the credit China has in having pulled down global poverty by and large. You know, we always talk about we've been successful around the world, but in fact, it is China who has been successful. We all claimed that success. So, yeah, I'll stop here. No
Thank you.
Politics.
Thank you so much. Well, look, I know we're standing between everyone and lunch, so I'll be very quick. I just want to say a huge vote of thanks to this fantastic panel of experts. I think the conversation has confronted the challenges we face in stark terms, but I've also found it personally heartening. I think it's reaffirmed the importance of law, the importance of aspiration towards law, and the fact that it does still matter. And I think it's also pointed, yes, to the challenge for the humanitarian sector, but also the opportunities and some of the actions that organizations can take upon themselves. And I hope that all of us who work for different organizations can take away a reflection on how what kind of a role we play in pushing forward this agenda, because it matters to everybody's work. So thank you very much indeed. Thank you for being with us, and thank you to the organizers.
please have a seat?
¿Quieres?
People to have take your seat, then we can start this last session. Hello, everybody. Thank you so much for being here after such a intensive conference. We're here to talk about the future. Yeah. After 1.5 days of very intense discussion on localization, people real needs, new narratives, localization, new priorities, One Health, violence, localizations, it's time to talk about. No, we're not going to talk about the localization. We're going to try to project ourselves into the future. We might talk about localization, though, but anyway. So it's very important to, we look very much into ourselves, but it's also important to take care of, to take into account what's around us. And we know that the situation is quite bleak, let's be honest, with some kind of orange-faced guy within the White House putting us into wars, but also into economical and energy crisis within a very difficult economical context with very, stretched budget and constrained budget, as well as a potential financial crisis around the corner. And let's add to that the climate, biodiversity crisis, the end of international law, the rise of populism, the fact that there is such a fear and hate of migrants, and then we have this AI waiting for us around the corner. So definitely we are facing many challenges. Definitely we need to change, but we don't need to change whatsoever. We need to change and stick to our values. We need to change and stick to our mission. And that's what we're here to talk about. And I'm very happy to trying to facilitate this very rich and diverse panel. Thank you so much for being there. I will ask everybody to present himself or herself, mostly herself, I guess, with the perspective of the discussion that we're going to have. So we're going to have like classical 1-hour panel discussion, and then we'll have a Q&A session. Who wants to start? Ellie?
I almost failed at the first test. My name is Ailey Kennedy. I'm one of the co-directors at Yarn, and I'm here today really to be a conduit for some of the findings that we've had through the Future of Aid 2040 project, which has been a very consultative process that we've been running over the last few years, and it's been my absolute immense privilege to be a facilitator of it. So I'm looking forward to sharing the challenging findings of that with you today.
Katharina?
Yeah, good afternoon. I'm happy to be here. My name is Katharina Spieß. I'm heading the Division for Crisis Management, Transitional Development Assistance and Infrastructure in Crises at the German Federal Ministry for Economic Cooperation and Development. And with the Transitional Development Assistance, we as a development actor, I have to say, as coming from a development ministry, we have a financing instrument at hand that focuses specifically on the HDP nexus and on the crisis.
Thank you. Kenan?
Thank you very much. I'm Kenan Diab. I am the coordinator of the Syria Localization Lab, and I'm also here on behalf of my colleagues at Near Network. Hopefully I will be speaking on how localization looks for us in the Global South, let's say, us in the field, and how it would look like for us in the future in an ideal world.
Krishna, we know you, but still introduce yourself, please.
Hi, my name is Chris Gomez, and I'm from the Philippines. I'm a human rights lawyer turned futurist, and I'm a co-founder of Rogue Union, which is a union of rogues. And we train together to build new muscles for the chaotic times that we have. I liken myself to a personal trainer, except I don't work at the gym. I work with NGOs and leadership teams in our sector to build those futures muscles.
Thank you. Liz?
Hi, everyone. My name is Liz. I'm Brazilian. I'm coordinator at Alafia Lab. It's a research and innovation lab based in Salvador, Bahia, in Brazil. And we do research and advocacy to understand and transform the relationships between communication, society, and internet. And I'm also a researcher at University of São Paulo and recently University of Dortmund too. And my role here is to try to localize the digital debate, the digitalization inside all of these amazing debates that we are having since yesterday, and try to understand the digital as an actor in the crisis, in the conflicts, not just the place where the narratives circulate, but also an actor that shape and organize these narratives and these conflicts too. So really difficult questions today, but I'm excited to think about the future.
It's very, very exciting. Thank you. Just a few words on me, just for the sake of the debate. So I'm head of Médecins du Monde Luxembourg. We're only active in Luxembourg, which is quite amazing. This morning we talk about the poorest country in the world, Sudan or South Sudan. I'm sorry if I'm confusing both countries. Luxembourg per capita is the richest country in the world, but still in our medical center last year we had more than 1,200 people having no access to health. But for a long time, we've been asking ourselves, should we go international or not? Yesterday, remember, Tana said, well, if we had to start from scratch, to restart from scratch, what should we do? Well, I guess MDM Luxembourg is in that situation. What should we do if we start from scratch today? So I'm, I guess, the first one interested by the conclusion of this debate. So I reckon on you to come up with nice solutions. We had, I guess, a great lunch, but after a day and a half of meetings, the energy is perhaps a bit lacking. So we're going to do some exercises. Gym exercises, like you were mentioning, but also neurological exercises. So it's very simple. When I say something, you just do the contrary. So if I say sit down, I'm standing up, okay? So we're going to do that like for 20 minutes, and then we go into the debate, okay? Then you'll be waking up. Okay, sit down. Lift your arm, your right arm, left one. Lift your left arm. Exactly. Sorry for me. Okay, put your right arm on your left shoulder. Okay, put your right knee under your left hand.
Yeah.
No, I can't.
A bit of balance as well. And then last but not least, you know, we all need money. So the money is deep in the ground. So let's collect the money deep in the ground. Let's go down. No. Finish. New exercise, sorry. My apologize, my bad. Okay, you take your real right arm and you get the money down, very down, very down. You collect as much as possible, and then you try to reach as much impact as possible. The highest impact possible, higher. One more time. Very down. And then let's go up, highest impact possible. Thank you very much. You can applaud yourself. Okay, now we all fit to start the discussion. Let's go with the first round of diagnosis. And let's start with Ellie. Ellie, you said a few words about your study and your research. And I guess the question is, we all know that resources are shrinking, needs are increasing, and there is some need for reform. Can we do those reforms? Or are we getting close to the limitations of who we are, what we are, and the system we're in?
Well, I think we very nearly reached my physical limits with that exercise. But I think the question on reform is a really important one. And we discussed that I love the way this is framed, because I think it opens up our own bias within this conversation, that we limit ourselves before we even begin. The idea that a fundamental reform of the system wouldn't change our structural limits is not something that we should consider. If we're truly serious about reform, and if we try and unpack it and really be creative with what kinds of solutions we're able to action and implement, then I think the limits of our system will change. That doesn't mean that we need to be growing and expanding the way we do business now, but we need to think very differently about how communities can be serviced. We need to acknowledge that some of that is none of our business and that they manage it themselves, and we interceding in that is going to create more problems than it solves. We need to think about how we can work differently, find different avenues of creativity and strength to deliver. So I think you're right that the challenges we face now by far outstrip the capacity of our system to be able to respond to it. But I think that means that what we need to do is to change the system. So we need to start doing that in earnest and not think of reform as something that just alters slightly what we have now, but think of reform as actually a fundamental restructure on which everything is on the table, and take it from there.
Okay, thank you. Kenan, I guess this afternoon you are our localization guy. From your perspective, how is localization playing out? Does it challenge power enough to go into the changes that Eli was mentioning?
Well, overall, the concept of localization has been uneven and contradicting sometimes. It is unique to talk about the Syrian context because we, until 2011, we did have the same starting point for civil society across areas of the country, and we were discussing how it was divided geopolitically. We didn't have an actual wall between parts of the country, but we did have different external factors, and it's usually said that, for example, in northwest Syria, we had the most advanced localization agenda. And usually this is refers to by, when talking about, for example, coordination, that Syrian actors not only had a role in clusters, for example, but they were also co-leading in some of them. We did have relatively a certain influence on deciding on allocations or priorities. But if you look at it with, zooming in a bit more, you will see that, for example, in coordination, we do have a seat at the table. Sometimes it's cosmetic, sometimes it's not, but it definitely has its limitations. And if you're not saying what you're supposed to be saying within the limitation, you're out, and God knows there are 10 more local actors who are more than happy to have that seat, right? And when we're talking about influencing, we want to think that we have influence on international actors or on donors. I think in reality, we just got smarter in knowing how to deal with them, what they are willing to work on with us and whatnot. So in our best case scenario, we just know how to navigate between different donors to work on it. However, still, when we're deciding on what we want to do, pretty much, we are still framed within the system itself. I didn't want to talk much about funding because I think, yesterday and today, a lot of people spoke about funding. But I don't think this is how you can measure things, because a lot of funding was received by local actors until it was not, it was limited. Then everyone switched back to their own survival. So I think it's the structure of how and who is controlling how the system works is what matters, and this is how we can measure localization in a sense.
We'll talk further about it with Katerina, I guess, but let's go to the digital world, Liz. What do you think? Do you think it's mirroring the current inequalities within our societies? Can we talk about digital colonialism as well, or this is such a negative view of it?
Yeah, I would like also to address what Keenan said, because who has the power build this? So when we're talking about the digital world, is the same. Who has the power to build this technology, to build these narratives, also shape how we in the Global South understand our world, how we can construct the views of a world. And that's the concept that you mentioned, the digital colonialism is not colonialism, all we know what is it for centuries, unfortunately. And the digital perspective is to understand that these inequalities come also to the digital world. So we can think this in a lot of perspectives. The digital colonialism can see as an umbrella for a lot of inequalities, like infrastructure inequalities, when you can think about data centers and the predatory consumption of water to use them, and also the extraction of minerals to create technology also came from the Global South countries. But we also can understand something that some authors think about epistemic injustice, is the fact that these technologies and all the rules that rule this digital world was built in the North global countries to their context, not to our context. And that's make that this digital space is ruled by these rules and does not connect with the context, the local context that we have. So we can see this in surveillance infrastructure, like we have some research, for example, in Brazil that shows that 90% of the prisons made by facial recognition in Brazil is from Black people. And there's other studies that show that when we are thinking about this type of technology, they have 100 times more chance to make mistakes when we are recognizing Black people. So that shows us how many people in Brazil or other countries are being arrested by mistakes of the technology. They were built like this. They are not built for people like us. They were built for other contexts. So we can face these inequalities in a lot of ways, and content moderation and the lack of context in that. And yeah, that's some of the challenges that we have thinking about the digital world.
We'll talk about a way to address them in the future, don't worry. Katarina, we love donors, so thank you so much for being here already. I think it's very interesting to hear your perspective on this, overlapping crisis, on the fact that we see a shrinking civil society, we're a limited humanitarian space. So as a donor, how do you project yourself to deal with that, to make sure that indeed the money is well used with the purpose that you want to give to that money? If we can give her a microphone. Oh, you have one. Thank you.
Yeah, thank you for the question, and very diverse opening, I have to say. So you said it already in your introduction. It's extremely challenging times. We see more and more overlapping crises. We see conflict. We see climate crisis. We see other types of crises. We see, as you said, the civil society being under pressure in many of those contexts. And at the same time, we see a sharp decline of funding on the humanitarian side and on the development side. So what does it mean for us, for a donor who tries to best bridge the gap between the humanitarian and development, and to strengthen the resilience of those most affected by crises? So I think there are a couple of concerns. Obviously, a great concern is the role and the possibilities of local civil society to act. We need a strong civil society so that they are enabled, because they will find the solution with local authorities to the crisis concerned. And the second one, and this is something I'd like to, this is an open question, and I don't know whether we already have enough data about that. My understanding, or what I understood from the sharp decline of funding, is that it was mostly local civil society that was affected by this decrease of funding. So I'm concerned that at this point in time, we are losing those partners that we as development actors need to work with them to come up with more sustainable solutions, or to support them in finding more sustainable solutions. Maybe I leave it here.
You can go on. I mean, okay. Chris, we're talking about organization, but behind the organization, we do have people who are struggling with difficult times, bleak perspectives, questions about their jobs, and so on. Okay, what to do with it? How do we deal with it? How can we keep those people up to be imaginative for the future, for example?
Before I go into how,
yeah.
I'm going to give you a bit of neuroscience as to what happens to our brain and why it's hard to think about futures. So there's a long list of how we are wired as human beings, our cognitive biases that make it hard for us. But since I'm very kind to you, I'm going to give you only 2, so you don't get depressed. The first one is they did hundreds of scans of the human brain using an fMRI, where they asked people to think about their current selves. Those scanning them were focusing on one part of the brain called the medial prefrontal cortex. It's the center of the brain that has to do with the awareness of yourself and also empathy. Right? When they ask people to think about their current self, that part of the brain would light up, meaning they could recognize that, yes, that's me, and I have empathy for that person. But then when they ask the same people to think about their future selves, that part of the brain would power down. As if to say that we actually see our future selves as if they're strangers, as if they're people we don't necessarily have the same empathy for as our current selves. What that means in terms of decision-making is, do I spend all my money now or do I save for retirement? Do I eat that extra bar of chocolate or do you only live once? At an organizational level, that then manifests, like what you said, we are the basic unit of organizations. Organizations make decisions without realizing that there's a big brain that powers that, both as humans and as organizations, that make decisions that benefit the short-term survival than the long-term flourishing or thriving of the organization. That's the first one. And I can give an example, but if we have time.
Go ahead, we have time. Go ahead.
We have, how much time do you have? I was speaking with the head of an association of NGOs, mostly INGOs in a particular country that I shall not name. And I told the director, would you want to engage and support these organizations in thinking about future so you can be resilient? And she said, no. Respectfully, no, because there are funding cuts, they're letting go of people, there's emotional draining, they just don't have the time to think about the future, which is smart if you're thinking short term. But that's the reason why we keep coming back to this situation, because we never put ourselves in a situation where we can thrive and be resilient through different futures. So futures thinking is the first thing that goes out the window when people have no mental load, emotional bandwidth, and resources. That's the first bias. The second way that our brain is wired is what they call normalcy bias. You know the saying, keep calm and carry on? That's hardwired in us. Apparently, when we're faced with disruption, our brain tells us that, you know what, it might get bad, but it won't necessarily get that bad. Or even if it gets that bad, it might not necessarily happen to me. It turns out that during 9/11, it took people in the Twin Towers an average of 30 minutes to evacuate. Some people even finished their activities and shut down their computers while the buildings were on fire. And this has nothing to do with the intelligence of those people. These are very smart, good people. But because of how we're wired, it helps us cope with disruptions, and there are disruptions in life every day. Great for coping with slightly disruptive stuff, but when we're faced with truly disruptive stuff, we don't react as we should. And that's why, even if we've been talking about the decline of the aid system for 2 decades, why were we still shocked when things happened the last couple of years? Exactly, hallelujah. Yeah.
Thank you. Okay, anyone has anything to add for this first round, because we have more time than foreseen? Katerina, on resilience, You want to say something, maybe? That's one of your priorities, and then we talk about the second round.
I'm happy. So I think there are different, resilience is a huge word, but I think you pointed at something, and this is something that is also of concern for us. We all know that humanitarian crises can be averted, can be somehow addressed, and can be overcome if we invest in the resilience of the communities, of the people concerned. This means we need to start beforehand, we need to work within the acute crisis, and we need to work in a longer time. Here I come back to what I said in the beginning. It's for us, it's vital then to have like local civil society, local actors, local authorities with whom we can work before, within, and then after the crisis. And I think this is something, again, where we are faced as a donor, as funding is declining. How do we maintain this system, I think, where we also find very good examples where it has worked, and we as development actors, like we start early in a crisis, we try to come up not only with anticipatory action, humanitarian anticipatory action, but let's say social security systems and so on. How will we be able to maintain that? And when specific structures are at this point in time so much under stress. And also, maybe also one point, and this is not only a donor, but also speaking here for or facing a public, for example, in Germany, that is more and more critical towards this type of support. Because resilience is something where you don't see immediate results. It takes time until you see the results. Once you have the results, they are excellent. So I can give you an example of Niger, where we have had a huge program invested in the resilience of the communities, and then when the next shock hit those precise communities, they were not in need of humanitarian assistance. So I mean, there was resilience, but it takes time. So also to tell this story to the German public is also something that is very important, where we also need your help, by the way.
Thank you so much. Well, you can keep your microphone to go on to round two, which is a bit like, okay, we started from the diagnosis, we're going farther into projecting ourselves, but we know we need to change. We know the system also has to change, and the question is, how do we do that? And maybe, Katerina, you as a donor, how can you trigger deeper transformation? What kind of tools do you have to trigger transformation and the system in general within the INGO that you are trying to support? How would you look at it?
That is a very huge question, isn't it?
We have the whole afternoon, don't worry. I just talked to Mariam, it's okay.
No, okay. So how do we trigger? So what kind of transformation do we need? This is
and how do you, as a donor, push for this transformation in the way you fund projects and organizations?
Sure. Let me think for 1 second.
For sure.
Then I find the perfect answer to it. No, I will start with some of the things that we have already started doing. We ask INGOs to work even more closely with local NGOs, or to work in a consortium. So what do we need? We need, I think, more cooperation amongst those actors that are addressing humanitarian crisis. I think we all know, and there is, as you said, there is a competition between INGOs and UNs and also local NGOs. There's sometimes overlap, there's also sometimes mission creeping and so on. This is something, maybe we definitely had a role in that as donor. Sorry. Okay, we had a role in that as donor, but what we need to, and where we closely look at, is to really sit down with our partners and say, okay, how can you work together to really bring at the table what is your unique somehow experience, so that we can address a crisis in a more holistic way. So this is the first thing. We expect cooperation, and also cooperation like then with local NGOs. German funding law is made in a manner that we cannot, it's very difficult for us to fund local NGOs directly, so we always need an intermediary. And we have different possibilities to do so. However, what we can do is to bring them indirectly more to the table. So this is the first point. The second point, as I said, we try, and this is, I think, I find it very challenging at this point in time. We strive at funding partners in a way that they are in a position to address a crisis, like from a short-term intervention to a longer-term intervention, so that in order to break the silo that the system has been working in because of different reasons. So really breaking the silo. I think I leave it here.
Well, that's already very, very interesting. Kenan, well, Katharina just talked about a local organization. You've been through crisis and wars and so forth. So what should localization look like in conflict setting? How the transfer of power could operate and could become a reality? And are there red lines about this transfer of power?
First of all, I think you did put a lot of pressure on Katharina, honestly.
Yeah.
And
Sorry about
this is
that,
usually
Katharina.
this is how we treat the system. But I kind of think that we are treating the system in a sense that, it's like Atlas holding the world, and it's going to fall apart if we don't have the reform or whatnot. And I'm sorry to burst that bubble, but the reality is that, this is not the only system, right? Organic alternatives not only can exist, but already exist in a lot of contexts. We do have sometimes regional or locally led pool funds. It happens. It is not less ethical. It's not less, committed to the humanitarian principles. It does provide better end results for the people we're trying to serve. And if I'm going to just address the elephant in the room, there's, especially when you're talking about the conflict, and usually what happens with conflicts is that the public sector, that is usually the main service provider, but also the body that provides the governance, the policy making, is lacking either the ability or the will. And guess what? It happens in all contexts. And this is where we end up with one system deciding that we are the only legitimate body that can decide priorities, decide how allocations should go. And again, it shifts back to what I was mentioning about power. And unless we break this cycle of who has this power, I don't think it is going to pretty much end. And different systems refer to at least I can think of 3 different sections of it. So with funding, I already mentioned that locally led pool funds could be a solution for that. But also with coordination itself. We always treat coordination in a standardized way. These are the clusters, these are the existing, we just have standardized boxes that we have to work within. But the reality says no. And again, since I was talking about Syria, we do have the previously regime-controlled areas had a civil society that was not even exposed to the system at all. And they did manage within their own capacity, without even being exposed to the system or actually polluted by the system, to find a way. So maybe what it takes is a shock that, you just were referring to by certain politicians, that will break this current system rather than reform it, and we will see that, no, we are actually able to create our own, in a sense. Because this current system is all pro-localization until you hit the areas of power, and then it stops.
So what to do with it? How to deal with it?
Recognize that there are other systems in place, and just have the accept that they overlap, and just accept it for what it is. I think I'll save the rest of the solutions for the final round.
Thank you, thank you. Okay, Liz, so the vision you told us about is quite bleak. As a society, what can we ask from governments, big techs and so forth to get a better future regarding digitalization?
A lot of things that we can demand for. In my first intervention, I was trying to localizate that the digital harms affect different people in different levels. And I think when you are thinking about how we can do it better, it also needs to understand the context levels. We not have one answer for all the problems, and that's a lot of problems that I could not have time for address this here. But just to say that's not one path in one way. It always depends of the context and any country has these needs. But one thing that I think that's common and we can address like globally is understand that we need a regulation based on human rights to digital platforms, to AI, to all the digital environment, because these platforms, they work with the market values and to profit, and not are counting on human rights to understand and to create their own policies, own rules. So this is the one path that I think we need to address. And also, I would like to emphasize that it's not just copy and paste regulations. Here in Europe, we have a strong regulation, the Digital Services Act is really important, and also AI Act, but we cannot just copy and paste to our countries because we have different needs to address. It's important to have inspiration. It's important to also open paths to address and demand some parts, some things, but we cannot just copy and paste. So I think that's one thing that I would like to address. Also, I think that we need to demand for platform accountability. Yesterday we talked about a lot of NGOs accountability and donors accountability, and we also need to understand the digital accountability. What their platforms and the big techs are doing with our data, what is it my photo that I posted in Brazil is being used to train AI models, and someone in other country will generate a photo of me? I don't know. So we don't have this accountability, not just to digital and social media platforms, but also when you're thinking about workers and digital platforms like Uber. In Brazil, we have iFood and other delivery platforms. So we need to also address the accountability of all these systems to understand how we can do a better thing. And just to finish, I would like also to understand and address the needs for investment in local contexts, investments in local languages, in culture and political specificities, because as I said before, it's important to address the context, the local context in content moderation, in how these technologies are built, and also just matching what was said before about the long funding, because to address some of these problems, we need to also think and build new infrastructure, public infrastructure, digital infrastructure, and this demands also long fundings, not just project fundings, to address these things. And I will keep it here, and after I can bring some examples too.
Thanks. Ellie, back to you. Your work addresses the new role of INGO. Let's be blunt. What should INGO stop doing?
I rarely have trouble being blunt, so I'll take you up on that offer. I think, as Chris said, thinking about the future is a hard thing. So we can all acknowledge that. But I don't think anyone who started a job in the aid industry thought they were going to do something easy. So let's do the hard thing. I think what we need fundamentally is a mindset shift, and I don't need to explain this myself because colleagues have been doing it for the last few days. Nanette mentioned in the session on narratives, the fact that we need to challenge assumptions. Often when these conversations happen, there are assumptions made about how much capacity is on the ground, about what exists there. We make assumptions, we don't really check. We also, I think, all live with an inner assumption that we do it better. It's quite human to have that, but let's be honest, that also colors our decision making. Adelina mentioned in her talk about the fact that we are not the center of the system. Kinan just mentioned it. What do we need most? In a mindset, it's humility, but also what a gift that is. Sometimes we have these conversations about localization, and it feels like the conversation is, if you don't show up to work tomorrow, the world is gonna collapse. No, that's not the way this works. There are so many different organizations on the ground every day delivering so much. If we leave, would there be a vacuum? Sure, for a little while. But you know what would grow very quickly is a way to respond to that. If we leave and we take all our money with us, is that a bigger problem? Potentially. But this is a question that we need to resolve, and if we are uncomfortable with that, then let's be a little bit uncomfortable. Nadine also talked in her opening speeches about how being a local organization can feel like climbing up a mountain when people are throwing rocks down at you. We should acknowledge that on our worst days, we are some of those people who are throwing rocks. We're making it harder for local organizations sometimes to do the work that they do, to be at the tables where they need to be. We are stepping in and taking money where we should be trying to give it straight to them. So we need to acknowledge that and try and not be defensive about it. And we also need to think about the fact that in our mindset, we need to reverse how we're operating and not think so much about ourselves and our own institutional survival, but how can we use our privilege to try and shelter other people from the rocks falling upon them? How can we be trying to change the system to make life easier for the people who are on the ground and delivering in a way that we say we want to support? So we need to be more humble. We need to be less defensive. And we also need to start thinking beyond the challenges, accept that it's a hard thing, and find a way forward. Some things we need to stop doing. The first one is excuses. I think, we had an opening speech where Dr. Alma-Ata was talking about how normal wasn't good, how Donald Trump coming was not like the start of the negative trends and political environment in which we find ourselves. We were not on a path towards realizing a localized aid system 5 years ago. We didn't do this when the going was good. So now to say we're not doing it because it's got harder is frankly not true. It's just another excuse as to why this isn't being implemented. Is it harder now? Potentially. But again, it's just harder now. It doesn't mean we stop doing it. It just means we need to find more creative ways to be implementing it. We need to have more courage with what the consequences are going to be and still move forward. We can't have this as an excuse where we say, now it's harder. We didn't do it when it was easy, and now we have to do it when it's hard. That is a collective failing we need to sit with. But again, not use it as an excuse, not to make progress into where we're going. I have 3 of these, by the way, so we're going to keep going on this.
Go on. Be blunt, be blunt.
I think the fact of the matter is we also need to change our narrative. We talked a lot about narratives yesterday, and I found it very inspiring. When we talk about localization, at least behind closed doors, it's often talked about as a challenge, a problem. There are things in the way. We're not incentivized to do it. Donors put conditions on money, we can't possibly spend it. If we're the ones who pull out, God knows what's going to happen next, right? This is often the way we talk about localization. There isn't enough capacity. We need to build capacity in the following areas. Now we've done that. It needs to be in the rest of these areas. We can't possibly leave without building yet more capacity. This goes on and on and on. And it's the narrative because we like to sit in this miasma of where we are. But enough, it's a hard thing. We have to do it and move on. We need to be more solutions focused. Another thing we need to stop doing, which is very true of our present time, is shrinking, not changing. In a response to the cutbacks in funding and the funding cliff, what we're seeing is a lot of organizations who are retracting, reducing, losing staff, but they're doing so in a way that maintains their structures, their systems, and their decision-making. We're getting smaller. Many of them aren't saying it out loud, but they're doing it while they're maintaining the capacity to rebuild. They are under what I think is a false assumption that at some point the money is coming back. It's coming back at scale. So the most important thing is to stay as a stable system so that you can grow again. This is fundamentally at odds with what we all think that we're supposed to be doing. Everyone says they're committed to localization, so let's actually be committed to that and understand that having smaller systems while maintaining the same decision-making and power structures does not deliver on transformation. There is no way that it's going to, and we shouldn't be pretending it will, because that's just going to waste more of our time rather than actually making progress. There are other things we should stop doing, but that I think is fundamentally the critical points, which is why we're not making any progress. Because it's not an easy thing to do. It comes at huge personal consequences. It's very hard to be talking about this in an environment where we know people are losing their jobs, and we know people have mortgages to pay, they have aging parents, young children. We have lots of individual and personal obligations, which make this a hard conversation. But the other thing we have to stop doing, again, is centering ourselves within this conversation. If you joined this sector, you didn't do so for your own benefit exclusively. We understand that this is a career, many people reap their rewards from it, but it's not supposed to be your reason for getting up in the morning. I also think we need to have a little bit more faith in ourselves. We can do this, and we can do it better. So let's just stop talking about it as though we've already failed. What can we influence? A lot, I think. You can hold space for the pain that this causes within our communities and our very close space. But again, we can't stay in that space. You have to move beyond it. Change happens, it needs to happen at every level of international organizations. Boards, leadership, middle management, implementing staff. No one is immune from this conversation. And what we're finding more and more is that in these conversations, everyone points in a different direction, right? The board is like, totally agreed, but like I can't sell it any lower down. Everyone lower down is like, oh my God, I'd love to, but the board says no. And so you get into this circular, again, challenge of the narrative, where everyone is just focused on what you can't do rather than what you can do. We need champions at every level, and everyone can exert influence. We also...
Last one.
Last point. Oh, you really promised me I could go on and on.
Pick a point.
Right. I think the last point is to say, we need to change our mindsets and think about every decision as if localization is already a reality. We need to stop talking about not if localization happens, but how you're making it happen today in every single decision you're taking. We need to talk about it as not a when we get around to doing localization, but a now. This is immediately. So not if, but how, not when, but now. And we need to use that to look for loopholes everywhere we can, to be able to strive against the incentive system that's set up to overcome the challenges that we have. And we need to start getting our dopamine hits from doing the right thing rather than talking about it. Someone said to me, and this really is my last point, that what INGOs really need to do is either do localization or not have so many panels on it. And I think that's really a good point. So.
That was blunt. Thank you so much. Chris, okay, she said the red lines, what we should stop be doing if we want to project ourselves. You're futurist. How can future back thinking help us?
So I'm going to start by first describing what future back thinking is, or futures thinking. Because people often come to me and say, Chris, I can't predict the future. I live in a volatile context. I operate in conflict zones or in a regime that changes their minds. So what's the point of futures thinking? But futures thinking is not about predicting that one future that will happen. What it does is, that's why you notice I say futures, plural, not one. What you do is you think radically about different futures, not caring whether is this realistic or not. No. Think about different futures and then work backwards from there to then make decisions today on what capabilities and changes in strategy, behavior, and organizational culture you need to make so you can thrive in any one of those futures or none of them. So you detach yourself from that obsession in forecasting or predicting, because no matter how different futures are, you will find common threads of strategic questions. Now, I'm going to describe to you two specific ways that it can work. The first one, so there was a simulation that was done by a futurist named Jane McGonigal with 20,000 people over 20 days, where they were asked to pre-live a future scenario. The scenario was a global respiratory pandemic originating in China. This was 10 years before COVID. over days, she asked these 20,000 people to pretend as if they were living in that future. Day 1, go out in public wearing a mask. Day 2, work from home. Day 3, refrain from social events. All of the things that we ended up doing during COVID 10 years later. Can you imagine how those 20,000 people fared when COVID actually happened? While the rest of us, including our governments, were reeling from shock and despair and walking around like headless chickens, these people, they're like, oh yeah, I know exactly what to do. I've lived through this reality, bring it on. So instead of panic and despair like how we feel now, they operated with that calm confidence. You take the shock out of the equation, and what remains is strategic confidence, and they were more able to be of help to others. So at an individual or at organizational level, it's so helpful. But because they did it in a social setting, by the way, we do these simulations all the time at Rogue Union, and I just did it with the crew at Doctors of the World, MDM, on Monday, so you've heard this, you can close your ears. But if you do it in a social setting, meaning people actually write journals every day as they experience that future, and they share those journals with each other. We do it in an online platform at Rogue Union, so you can read the journal entries of the experiences of people who are very different from you, living through the same reality. And what that does is you see different angles to the same future with a diversity of experiences that you can't bring by yourself. And then when you pull up, you see patterns of behavior within a group of people. In that pandemic simulation, they found out that women had a hard time balancing working from home and homeschooling their kids 10 years before COVID. They found out that people would break quarantine rules for religious worship. They found out that misinformation and disinformation was very prevalent. These are policy issues that you could determine by simulating a scenario long before that scenario happens, or even if it never happens. That's one way that futures thinking is really, really useful, even from an emotional standpoint. The second one, there's this thing called future benchmarking. We know what benchmarking is, or maybe not, I'm gonna describe it, which is when you wanna decide what to do, and INGOs especially, some of them do it, you compare yourself with the best practices of your peers, especially the best ones in the field. I actually know an INGO, they're really good. They did that. They were trying to future-proof their organization, so they interviewed the heads of their peer INGOs. And then they found out that, oh yeah, we don't do plans more than 3 years or 2 years because there's no point. But futures thinking is not telling you to come up with a 10-year action plan. That's ridiculous. You come up with your 1-year action plan, but based on a long-term trajectory. But since everyone else they benchmark to are behaving this way, they thought, okay, then we don't need to plan for more than 3 years. They had that false sense of certainty or confidence. They were benchmarking to the best practices of today. 2 weeks later, that sector basically lost a huge chunk of their funding when the government announced we're going to pull out billions of euros from civil society. No one was spared. But future benchmarking is you're not asking what is the best practice today, you're asking what are the best practices of the leader of my field 20 years from now, and then work backwards from there today. When we change, the kinds of transformations that Aileen has been talking about, they're hard. You get your staff and your board and your partners through a deep, painful, emotional process. And then by the time you finish that transformation, you've spent 5 years only to find out that by the time you get there, you need to transform again. So it's actually not helping you to keep benchmarking to what's good today. Benchmark to the future and work backwards from there.
Very interesting, thank you. Final round, imagination. Okay, Ellie, you were did quite a blunt vision of the sector. So what kind of future, different scenarios precisely do you see for the INGO, humanitarian INGO sector?
Well, I think what we're seeing at the moment, candidly, is a bit of a split. There are INGOs who are turning and investing much more in true and genuine local leadership. And by that, to be very clear, because I've only just realized recently that this isn't clear, by local leadership, we mean subordinating our own power and decision-making to those who are from the context and know it better and work in it every day and can tell us what's more important. It means accepting that we don't have a vote in how their money is spent. We can help them spend it if it's useful to them. We can ask them these questions, but it shouldn't be our decision what happens next. It has to be the communities who need the support. They're the ones who should tell us what to do. So I think having that outlook and that scenario is important. That's one, we see some organizations moving in that direction. We see other organizations who are turning, not necessarily the other way, but to think about reform in a way which I would describe really as being within the structural limits of what we look at today, to look a little bit more like the UN and UN-OCHA and how that is coming out now in terms of the way that money is being spent and distributed. And what we're finding there is in those conversations, the focus is much more on equitable decision-making. Now, both of these things sound good, right? Like locally led decision-making, equitable systems. But I think when you look beneath the surface, what do we mean by equitable decision-making? We mean that everyone around a table has an equal vote. Why do we get an equal vote in what happens somewhere else? Because when we often have these conversations, what's unsaid is that what that essentially looks like is the international community get an equal vote with local organizations, with communities in areas of intervention. So in Syria, in Palestine, in the Philippines, in other places. Are we really conceiving of the fact that if it was truly equal, they would have a decision in how we operate here? No, right? That's not realistically what we're talking about, which means that this is equality that goes one way. It means that everyone has a voice at international level, and international actors have a voice, but only where they choose to. And I think these things for a long time have been lumped together. There are things that often are talked about in the same way, but I think even for me, I'm only just realizing now quite how different those endpoints are. So the scenarios of where INGOs are going, I think it's going to be complicated. I think it's going to be mixed. I don't think we're all heading in the same direction. And I think what we really need to do is focus on what Chris was saying. You know, the future context, it's going to change. It looks differently in different regions. Even today, we're not going to have one monolithic context in which we're all operating. It's always different. So what is a principle that we can abide by, which I think would create a future for international organizations where they truly add value, is to understand and accept that our value should only be defined by the communities to whom we say we serve. If they're the ones defining our value and what our role looks like, then it's going to look different in every context, and we need to be prepared for that kind of adaptability. We can't control that level of future, but we can influence how we operate in those futures. And by using that, I think that's what's important. We are very afraid of that question about whether or not people see value in what we do. I think if we ask them, do you want us, or do you just want our money? We may not like the answer to that question. But I think if we're honest with ourselves, we kind of know that's the question we should be asking. And we should be okay with it if they say they just want the money, that they're going to lead without us. That is supposed to be what we were all working towards, that we were working ourselves out of a job. So I think we need to be open to that in every future.
Money or us? Microphone.
Don't do that to him on stage.
Well, it's kind of easy to go after Ellie because I will just mansplain what she just said. Honestly, these are my points, right? But seriously, now, in all of our talks, we discussed the system, we discussed the change in power, we discussed all of these details. And sometimes while trying to do this, we forgot, ultimately why we're doing this. And honestly, the uncle in Alma-Ata or the old lady in Idlib, they don't care less about this jargon. They don't care if you call it humanitarian development, whatever you want to call it, and God knows they don't care much for those acronyms we always use. So if you are building a system, right? I'm imagining my system here. I will imagine that it is accountable not to donors, honestly, because this is what we always care about. This is what we're scared of, right? Over compliance and whatnot. But actually to the people we are claiming that you are trying to serve, like plain and simple. And it goes all the way from the smallest grassroots initiative all the way to donors. And with this mindset, we can think on how this will happen. If we do this in the core of our thinking, we will have the local and national actors collecting agency, because we always claim to have agency over our communities, but sometimes we lose our compass. So once we have that, we can start building a system that revolves around those local and national actors. Not contextualized, it should be built by us, for us, in a sense. And then you can give us your money. But mainly this type of system I can think of. The involvement of international actors should not be considered a standard, but if there's a need for it, then fine, there's a need for it, but it should be kind of only bound. Otherwise, it's just this Sisyphean process that never ends. You just pulling the rock to the top of the mountain, then you're doing it again. And it's really important, again, I said it once, twice, this is the third time, but there are existing mechanisms in place. People don't wait for the UN. They don't wait, I'm sorry, but they don't wait for the white man to come over and start telling us how to do things. God knows we in Syria have, we have a certain million number of people, but they are the same, number of engineers, political analysts, experts, and everything. So we do have the technical capacity, honestly. Sometimes the organizational capacity we miss, but this can usually be covered within a workshop or a training most. Understanding context and why we can do certain things certain way and not. It took some INGOs 14 years working in our context, and they still don't understand it. And this is how they had to have us in clusters to begin with, right? And I'm just, being as blunt as I can. And speaking of coordination mechanisms, what happens is, again, they are just contextualized rather than led by us. There are a lot of terms that we really had to learn just to get the money. Like, we can call it, like, I can call it helping an old lady, helping, the women in our communities, but, a lot of jargon and a lot of boxes that were imposed on us that we had to learn, unlearn, relearn, rephrase just to get the money. It's just never ending. So if such a system exists, it should be built by us, and we should be the ones running it, having the power in it, exactly as you mentioned.
Okay. Katharina, I was going to ask you, what are the guidelines for the future for a donor? But maybe you would like to react to what those previous speakers have said, and indeed tell us a bit about how you project yourself for the future in terms of guidelines, as you feel. I don't want to trap you.
Yeah, I'm happy to. There's a lot of food for thought in that, and I won't comment on how the INGO scene is transforming itself. I think this is the job of the INGOs doing it themselves. But what I'd like to re-emphasize. I think this is the overall goal, isn't it? That it should be a locally led development. It should be decided by the people in the local communities, and it's not something there is to a certain extent an accountability towards us as a donor, because we use taxpayers' money, so we are accountable ourselves also to ensure that the taxpayers' money is used in a way that is in line with internationally agreed standards. So therefore, I think the future, and I saw that the question that originally was asked to me is like the framework, like the SDGs, still serves as a guiding anchor. And I would say, yes, of course. Because like, what are the Sustainable Development Goals? It's an internationally agreed framework where we all say, this is where we as all states want to reach at. It's a transformative agenda that does not only apply to the global south or to the global north, it applies to all of us. So in a way, it meant, and within this framework, we then should on eye to eye, how do you say, on an equal level, then discuss how can we achieve this Sustainable Development Goals jointly. And within that, and in addition to that, you mentioned human rights. I mean, human rights are then at the center of the individual activity, which means also that the state is accountable towards its citizens, but also in an international framework, there's an accountability. Maybe just saying this, I just want to re-emphasize that I do think that this framework is really an adequate framework also for international cooperation, because it puts it into a perspective that it concerns all of us in different manners, but on an equal level. And then coming back, breaking it down to the locally led development, yes. And therefore, what do I expect then as a donor from INGOs? I want to see their exit strategy. I want to see how do you exit in the situation where you are at one point in time maybe needed and dearly needed. I mean, we all know those contexts where it's crucial for the people on the ground that INGOs move in. But then we also need to understand better, and I think this is everybody's. We need an exit strategy, and we need to see that from the INGOs. Maybe to react to that quickly.
Thank you so much. Back to digital world. You've seen a lot of alternative initiatives in your studies, act of resistance, act of doing things differently. Maybe you could expose them now in the conclusion.
Yeah, sure. I think that when we are thinking about future, and this exercise is really important after 1.5 days of Congress, just to step down and think about different possibilities that we have and different paths that we can go. And when we are talking about the digital perspective, I would like to address this, that sometimes the big techs and the digital platforms, they have the power to kill our imagination, to think different perspectives. It seems like the technology is the only path to go. But I would like to refuse this. And it's not, we cannot think that technology is neutral, but also is not inevitable. They cannot make their own future that we have. So I think that the different futures that we are thinking about and thinking about the humanitarian perspective. I'm not from the humanitarian field, I'm like the outsider here, but I would like to imagine that all our future in different fields also depends on the decisions that we are making today about different perspectives. And one of them is the technology. The technology that we are building today is also going to shape our future. So we have a lot of good examples. As I don't want to leave you here just with the bad perspectives of big tech power. In the field, in the digital rights field, we are building beautiful things. Community networks in Brazil have indigenous community networks. They created to communicate themselves without going through the big tech. We have in Argentina, for example, different platform cooperatives to create new perspectives beyond digital platforms from workers. We also are building in civil society organizations that work with the digital rights, the possibility of think together different future. Alma-Ata Lab is part of the Global South Alliance, and we are building together different things how we can imagine in different countries from Global South, what the AI that we want to create, what this perspective that we want to build together. So also, I was invited to come and talk about the digital perspective, but also going in some of the themes that you brought about funding. Of course, digital rights is not outside the funding cuts and everything. And one thing that makes us stronger is work collective. Yesterday we had a really powerful panel about networks that we are building in Colombia and in other countries. And it's also something that we are building together, networks that we can reinforce and make power to make that our demands, our thoughts to be listened. So in the end, we are trying to understand how we can create digital sovereignty in our countries to not depend for the global north technologies only. We are not refusing them, of course. We need them. We work with that, but we also need to create different perspectives to build our own future too. So in Alma-Ata Lab, we had website that just covered disinformation, environmental. So we try to understand and explain the phenomenon. And we also did a report there showing these community networks that are building in Brazil that brings technology and connective to outside communities. And one of the interviews said that today the technologies are used to enrich billionaires, but we also can think that we can create different conditions of life. And that's what we are trying to create. And just to finish, Alafia, it's a name in Yoruba. It's an African language, and it means, there's a lot of meanings, but one of them is good paths, open paths, and we're really trying to think how we can create open paths for technology to create a better future.
Thank you so much. Chris, you have 5 minutes to explain how to set ourselves up to face those future different challenges.
I'm going to give you two tips.
Fingers in the nose, right?
2 tips, practical tips. Let's end with practical tips. The first one is, so in futures thinking, we say that it varies depending on the futures you're talking to, but I'm going to go with, there are 5 areas of reality that all interact to produce reality as we know it. They're social, technological, environmental, economic, and political. The acronym is easy. It's STEEP, S-T-E-E-P. As humans, we are wired to have blind spots. We're strong in 1 or 2 areas, and we don't pay attention to some. Including with MDM, just on Monday, I asked them to score themselves, the same way I've done this in many groups, how strong they are in each area. And by far, across the board in the social impact sector, we have a favorite blind spot, and that's technology. And we're saying that tech bros are taking over our lives and determining how the world should be, and yet we don't pay attention to that to be able to opine and have agency in making things not inevitable. A tip is, how do you build habits? Ask yourself. Me, I don't build habits by reading a long report. That's just me. I don't know you. I don't build habits by reading a long journal article on technology. I like reading magazines. So what I did 8 years ago when I found out that it was my blind spot, I picked the most fun magazine I would be happy to read when I'm tired, or especially when I'm tired. And I built that habit, and all it took me was 10 minutes a week. Now sometimes less, but I'm still doing it 8 years later. So ask yourself, number 1, what is my blind spot? That's awareness. And then, how do I build habits and approach it like you're building a new habit or building a new muscle at the gym? The second one is, so that's in terms of like area of reality or disciplinary area. The second one is, how many of you right now are doing organizational strategy or recently finished one or about to embark in one, thinking about strategy? Yes. So I work with organizations on strategy a lot, and we tend to focus on things like, right now, everyone's talking about closing civil society space. Well, we've been talking about that for the last 15 years. The aid cuts, and those are what we call in futures thinking as trends. These are the mainstream things that are really affecting our reality. From a futures point of view, I always say working or basing your strategy just on trends
is like cooking curry with one ingredient. It's important, but it's very insufficient. There are other spicy ingredients you need to put in your curry. One of them that I would highlight, that I would give a tip on, is what we call signals of change. Signals of change are not the mainstream phenomena. There's those small pockets of reality in the fringes, a new research, an anecdote you heard in a party. They're not mainstream, they're still peripheral, but if they mainstream, they can alter reality as we know it. It's really the definition of being ahead of the curve. We all like talking about the same things, reading the same reports, sharing the same news articles, and that's why we're very good at trends. And that's why we're shocked when something that was in the fringes 10 years ago suddenly mainstreams. Or even if they don't mainstream, they help us ask hard questions. As an example, a signal of change that I keep thinking about is, I was in a recent foresight process with other organizations. We were talking about fundamental rights. And everyone in the room was talking about human rights, very important. I mean, I'm a human rights lawyer. And then I shared a signal where a cloud forest in Ecuador is being petitioned to have authorship of a song, a legal personality to be recognized the author of a song. Because the song was recorded, they say, not in the forest, but with the forest. It follows a long precedent of dolphins having legal rights, rivers having legal rights, basically the more than human world having rights. And yet most people still talk only about, very important, human rights. But imagine a world where rights belong not just to humans, but also to the more than human world. That will alter our thinking about who is entitled to things, where nature is not just an object of preservation, but a subject of rights. That's still not mainstream, it's still a signal. Do we pay attention to signals? So, spot those signals. It can be done, it's a practice, it doesn't take a lot. If you want to get started, come to me after. I have a list of really cool things you can read while or podcasts, or check out Rogue Union. I sound like I'm advertising, but that's what we do. There are courses there where you can learn these muscles. I even take people to the forest, like leaders in social impact, so we can learn these muscles for a week. But even if you don't, so forget about Rogue Union, come to me if you want to. Chris, I just really want to learn this. Finally, as an organization, we need to make space, and not just permission, but encourage our staff and our leadership and our board to learn these habits. And leaders often think it costs a lot of money. Oh, now I have to hire a consultant like me to do a whole foresight process, 10 workshops. No. I actually tell them, don't do that. Start with the existing spaces. Find out about the culture of your organization, the natural spaces your team gravitates towards, and just spend 5 minutes in a staff meeting per month where people bring one signal of change each. If you keep doing that, people will never unlearn that skill. So that when you need to make hard decisions at the high level, it's not the leadership team or the board telling them we have to change. It comes from everywhere saying, of course we have to change.
Of course we have to change. Thank you so much for this very rich panel. I think you can give them an applause. So my boss just told me that we have time for 3 questions. Sorry about that, but I think the conversation was too rich. So we have someone with a microphone in the room. Yeah, lady there. So we take the 3 questions and then we answer them. Thank you.
Thank you very much for very interesting discussion and reflections. My name is Adelina Kamal and I'm from Indonesia. Talking about the futures, I find that many of us even are not living in the present, but still stuck in the past. So how can those of us who are still stuck in the past, not living in the present, engaging with the futures? That's number 1. And one of the things, and sorry to say this here, but this is the panel where when the term Global South and Global North were mentioned more than the other panels. And I'm guilty of that as well. But I feel like the term Global South and Global North are is inheritance from the past. Right? It was coined in the 1960s and 70s. And now we are living in the present when many countries in the global south are not poorer than the global north. I mean, you talk about Indonesia, we're going to be the 4th largest economy in the world in the next decades, right? So it is not applicable. So how can, my question to all, but perhaps to Krishna, because you're the lead futurist, what would be other term that we humanitarians can use when it comes to global south and global north? I feel like it keeps dividing us. Because if we work in humanitarian field, you want to recenter humanity, and within it is justice and equity. But if we keep dividing ourselves into this, the North and the West, how can we actually move into the future where we have shared responsibility and solidarity?
Thank you. Yeah. Okay, other questions? A lady over there and a man over there. We have 3 questions, I'm sorry. Only the right side of the room.
Yes, thank you. My question will be for Katarina. So you told us very clearly what you expect from INGO as a donor. As an INGO worker, I will tell you very clearly what I expect from a donor: to make partnerships, with local actors easier. It's to lighten, the burden of compliance and administrative requirements that donors have. And usually, when I have the opportunity to ask that question to a donor, I usually get the same reaction. It's either a very long silence or an answer that goes like, well, the law is the law. So I wanted to ask you, are you considering at BM, since you're encouraging your INGO partners to partner more with the local actors, which is something I think we should all encourage, are you at BMZ also making, the compliance and administrative rules easier as well? Thank you.
Thank you. And the last one was over there. Yeah. Thank you for the microphone bearer to run around.
Hi, first of all, my name is Laura Victoria Alzate Rodriguez from Fundación Halu. I actually had a similar comment because considering, for example, the name of the panel, Organizational Change, Systemic Limits, and Shared Responsibility, it's important to acknowledge as well that these systemic changes can be also addressed from the more higher levels of the system, and that includes donors, especially when addressing the new roles that INGOs can also have, and how could from these states incentivize these changes. And a particular question that I also have is how these, not exactly conditions, but frameworks of SDGs, for example, considered as universal frameworks and standards, can dialogue with acknowledging a pluriverse of knowledge in different parts of the world, considering also the discourses around localization. Thank you.
Okay, we have not much time to answer. Chris, you start with stuck in the past, especially when we talk about global south and global north. Any idea to change the narrative?
This is central to what we think of. Is it Adelina? Because I've been asking this question. I used to do futures thinking very differently in the past. And I always ask this question. We come up with all these fancy scenarios. When I look back at the organizations and the teams I worked with, did they produce an actual change in their behavior and culture or even strategy? Mostly no. So I've been problematizing this for the last several years. There are many reasons to it. There's power, but one of the key, again, I'm going back to the neuroscience and the psychology of it, one of the key reasons I've found is in our sector, it's not for everyone, but for most, true for me, the way we do things even our own projects, our initiatives. These are not just intellectual undertakings that we do for work. They're closely tied to our sense of self. We're very invested in them, and asking someone to change the way they work, the way they think, let go of their projects or their INGO is like asking them to grieve for their old selves. It's a question of identity for most. Change is very hard, painful, and it's deeply personal. The answer we found, Rogue Union, is how do we create a process that holds that vulnerability and pain and humanity? I'm a lawyer who had to learn contemplative practices. When we do our retreats and our trainings, we spend so much time giving people rest. We start not earlier than 10 a.m. We go for walks in the forest. We finish at 5. We don't do working lunches. I'm sorry to the Americans in the room. And we really ask ourselves, how do you open people with low mental and emotional bandwidth who are feeling under siege so they can be open to grieving for their old selves? It's a long conversation, but it's a recognition that it's not because people don't want to be stuck in the past. It's just that it's a deeply psychological thing. On your question of global north, global south, it's interesting. We talk about it and debate about it all the time in our team. My co-founder at Rogue Union, Ishtar, she's South African. She's a product of apartheid. She's a feminist activist. And we keep asking ourselves, do we still keep using global north, global south? We haven't come to a conclusion. This is a live debate, as many of you know. Just go to LinkedIn. There are long debates there. Some are calling for, let's call it global majority because, well, look at Indonesia, right? I wouldn't want to give the answer because at the end of the day, my answer to it is, it's like people should be able to claim the term that they identify with, where they feel this is not a product of colonialism or racism that was imposed on me, which I guess means maybe we'll not have one language. But I do recognize the complexity of it and that words carry meaning, concepts carry bias, and deep discrimination.
Thank you. Ili, one suggestion?
I think just to say, to build on what Chris says, I mean, I absolutely agree on the global south, global north. I think the language is super problematic, but we struggle to find an alternative way to describe it. And I think at least when we find ourselves in a position of needing to use that language, it's because to find a way to call out the inequality within the system, we need a language to be able to name one group or one area and to try and describe that. And that just seems at the moment to be the most common vernacular for people to use and understand that concept. But I agree, it's hugely problematic in many ways. I just wanted to say one thing and talk about what Chris says about the emotional side. Everything she said is absolutely true. It's super personal. It's a really big challenge. But I think what we also lack, and it comes to this point about narrative, is we look towards the past because we're more comfortable looking backwards. But it's also because I think we, as a community, have not really rallied around a vision for the future that excites us. When we talk about localization, as I said, we often talk about it like it's a problem, like it's a challenge, it's super difficult. We haven't really embraced the fact that it's a huge opportunity. Like, imagine if we pulled it off. How amazing would that be if in 10 years' time we're not having this conversation? If we really actually created a system that it's locally led, that we really had a system where there was local decision-making structure, where money flows that way, where it's more sustainable, where we're tapping sort of local resourcing base, where we're not having the same conversation again and again and again. That would be incredible. And we need to be more excited about that vision. Is it going to be painful to get there? Yes. Is it going to be painful for a lot of people? Yes. But the fact of the matter is, that is where I think we all want to get to. So let's get excited about it and start trying to talk about it in a positive way.
Katarina, compliance, donors, locally led.
I find it a pity to end with that because I think my two previous speakers were much more looking forward, because also I think my answer might be a bit frustrating. No, we are not going to lower compliance and accountability. We need to be compliant and accountable as well. Yet where we do have to look into jointly is how can we lighten the administrative burden? So how do we make it easier? And how can we best do that jointly, knowing that the system is under stress and knowing that the money needs to be used for other things as well? Sorry, I'm being very short.
And what about systemic change that you guys could incentivize? We talked about it a little bit.
How much time do we have for that?
2 minutes, I'm afraid.
I think, yeah, this is why, and you might have noticed that for me, the Sustainable Development Goals are really something. This is part of the systemic change. I mean, it's more on a broader picture, but I do think it's important to re-emphasize the importance of the Sustainable Development Goals and also of the Agenda 2030. That is like a transformative agenda. What does it then mean in terms of system change within the humanitarian system, within the system, how to address crises, I think is yet another discussion. And I would take it as a follow-on question on how we can further incentivize that. And we'd be very interested in your view on that as well. We have ideas on that, but I think it's a joint discussion that we have to discuss with all stakeholders, by the way, because as we have just seen, there are very different views on that as well. It's the local perspective, which I think is the most important. It's the INGOs, it's other actors as well.
Thank you so much. Okay, very last one. My boss just left, so I can... Oh, she's there. Oh, sorry.
Thank you so much.
The very last one.
Yes. Also a question for you. So I was wondering, because you said that...
Microphone?
That the INGOs need to be accountable to the German taxpayers. And I was wondering, is maybe in the future of humanitarianism also... Like, is maybe Germany as one of the biggest exports, countries of exports of weapons, is that also part of the future of humanitarianism? Maybe how is Germany to be held accountable to, for example, Syria?
I'm afraid it's for you, Katharina. Do you have a no, microphone's not working anymore, right?
No, I think these are questions to be discussed.
Sure.
But I'm coming here from the Ministry for Economic Cooperation and Development, and I'm looking, and we are talking about the humanitarian system, and that there are other questions where accountability matters, obviously.
Well, I think we can stop here. We stay seated because just right after us leaving the stage, we will have the wrapping session with Katri and Anne. And thank you so much for your attention. I thought it was a very interesting discussion. And thank you again to the panelists. A last applause for them. Thank you so much.
Waiting for the other participants from the Kuppelhalle to arrive, and then we will have from two participants a short wrap-up and a short reflection about the Congress and an official closing. So thank you very much for staying here, and we'll start in a couple of minutes when the others arrive. Thank you.
We're going to close in a minute. I know everybody wants to stand. I definitely feel that too. I remember Chris's opening saying that smoking is, sitting is the new smoking. But if you do need to move around a bit, please do. But do take your seats so we can start with the closing session. Thank you.
Hello, everyone. I'm just going to start and then assume that you guys are going to come along for the ride. It is, I know, the closing. You've been here for 2 days. This won't be too long, but we're happy you're here. My name is Annie. I'm an editor at the New Humanitarian, which is not up there, but is one of the organizations present here. And what we're going to do is just, instead of just talking at you, I'm sure you've had some of that in the last few days and in your professional lives. We're going to talk to each other a bit about, ask each other some questions about our reflections on the last few days. For me, they're going to be quite fresh because I just came off moderating another panel and sort of ran here. So I will first ask a question and then catch my breath. But thank you, really, everyone, for joining us. This year's Congress is taking place, Katri, a few years into massive aid cuts, which, of course, you all know. And, you know, also a few years of what I would say are a lot of discussion that, you know, massive change is needed in the sector. You have just taken on a new role as head of Médecins du Monde, Doctors of the World, Germany. So for you, reflecting on the start of your job, how long have it's pretty new, and the last few days, do you see any fundamental changes in how the sector is working now?
Thanks, Annie, and thanks for staying around. I've been here for 2 days, so I've been in all of the panels and sessions as you have. I think the great thing about these Congress formats, and especially the Humanitarian Congress, is that it brings our community together and also allows us for the time in between the sessions. So I've also been listening to where things are at while we are walking in the beautiful gardens upstairs, in the lunch breaks, in the coffee breaks. And as you said, it's quite a fundamental change to our sector. And it's quite interesting. We haven't talked about it a lot in the formal session pieces. So we've talked tons about narratives. You just ran a session on that too. That word has come up at least 500 times over the last 2 days, from what I've counted. And we've talked very indirectly in the sessions about the funding cuts. A few people have mentioned it, and it's definitely the most talked about issue in the breaks, though. So that's been quite interesting to reflect on, because all of us as organizations, or whether you are going to join the community and want to work here or have already worked for a couple of decades and left, we're really all feeling it. And so I think there's, it's quite interesting to think about polycrisis in these times. I don't like that word because it's overused, but I do think it reflects where we are at a sector. So we not only have our normal crises that we work on, and that's part of our raison d'etre as a sector, and as we know, those are increasing by the week. We also have this financing crisis. As you've heard here in Berlin, this is very much also in Germany. The aid and humanitarian budgets have been slashed radically. The cuts are going to continue. I think we're only starting to see just how bad it will get. It will get worse. That is the funding reality at the moment. And then we also have this legitimacy crisis, which I think has been alluded to in some of the panels. So really this question of, are NGOs still a force of good, right? Or are we some panelists have called it threatened as terrorists, as carriers of disinformation, as there are lots of horrible terms that have already been used. So that 3 levels of crisis is really hitting us, and that financing crisis that is going to be also existential for us as organizations, no matter where you work, internationally, nationally, or locally, is something I think we haven't talked and thought enough about. And that's maybe one of my critical reflections on the discussions over the last 2 days. We still seem to be in a comfort space. We don't really want to leave it. We're comfortable about talking about narratives and things we can control, and we feel like the funding issue is so far out of our control that we're not really ready to go there yet, yet it is hitting us. Yeah. So those are a few thoughts from my side. On the narrative topic, you are a journalist, and I was sitting in your session, kind of running over together with you just now. We had a chat before as well, and you've changed the way you report and write about crises and conflicts quite fundamentally over the last couple of years. So also in this larger format, it would be great if you could talk us through what you've been doing and also the why.
Yeah, I mean, you mentioned, we mentioned the crisis of funding, and I also don't like the term poly-crisis. But I work on the Middle East and in the Middle East, and I'll be quite candid in saying that I've probably had my own crisis in terms of journalism and what the point is over the past few years. I think for me, seeing that, or feeling that no amount of reporting or live streaming has the ability to stop a genocide was very painful. This year, I was just looking up the numbers, despite the fact that, record numbers of journalists have been killed in the past 2 years. Mostly Palestinians killed by the Israeli army, but also journalists in Ukraine and Sudan. So I think I did lose my faith for a bit in journalism. I took a break. And I eventually came back around to sort of re-embarking on a journey, I guess I'm going to call it, of 2 things. One is reconsidering what we think of as newsworthy. As you mentioned, the word narratives has come up 500 times. I'm going to make that 501. I think, and this is true not just for journalism, I think it's probably also true for the aid sector, is that whose stories are told and whose stories are considered important and how that's done is usually chosen by, or traditionally has been chosen through the lens of white, Western, cis, heterosexual men. I think I got them all. And that changes what news you get and how you get it, and whose lives are considered as important. But also how the news is produced, I think really matters, and that's what I was talking about with my colleagues on the panel before this. My practice has become more participatory, which is really co-creating work with people who are living through these crises to tell their own stories in their own languages in ways that are meaningful to them. That I think, hopefully anyway, acknowledges that people are more than what happened to them on the worst day of their lives. I hope that's something that we can, that the sector can also do. I mean, I don't want to go through all my work, but one thing that I've been thinking about a lot today and for the last few weeks and months, as you know, is that one of those projects is called the Lebanon Displacement Diaries, which is was published in late 2024 when there was a ceasefire. And it's the story of 10 people who were displaced during that time. And I think, unfortunately, it's become painfully quite relevant again. Everyone who told their stories and is still in Lebanon has been forced to leave their homes again, although some are not in Lebanon anymore, as did the project coordinator and my close friend Zainab. But the thing that I think is really important about that also, in addition to, of course, it's important to my own sort of practice and coming around back to journalism, but is that something like that, displacement, which is a term that we use a lot, IDPs, et cetera, is not, it sounds really technical, and I think when it comes in the news, it also sounds really technical, but these kind of participatory processes, which can also involve programming, which can also involve comms, which can be involved in a lot of the work we do, it does not get to how difficult it is, and I'm not talking just about this project, but about conversations I have with people every few minutes in the last few weeks, how uprooting it is and how violent it is to have to decide if the bomb that hit over there is the one that means you should leave, to decide whether you need to sort of just leave your cat at home, how to convince your dad that he has to leave the home that he built, and just what an all-encompassing experience that is, that doesn't end even if you are able to go back. So for me, through, I think, partly that project and this kind of participatory journalism, I've come around to believing that maybe it's not going to change the world on a very big level, but that helping people share these stories actually does matter, and giving up some power to people to tell them instead of me telling them does matter. I guess one of the things I've been thinking of here is I go to a lot of conferences, journalism, because I'm at sort of the intersection of aid and journalism. And I feel like some of the topics that have come up here and that come up a lot, like localization, gender, erosion of humanitarian norms, they're so crucial. But I do also feel like they keep coming up and they keep getting discussed again and again. And I'm never really sure like what moves and what changes. So, I mean, what kind of concrete actions, you've got a new job, are you gonna take home with this when you go back to work on, well, depending if you're going back to work tomorrow or taking a few days off, going on Monday?
Thank you, and thanks for sharing about your work. I had one or two colleagues when I was asking what should I talk about and what should I still emphasize at the end. They were like, we're so good at talking about problems and crises and how horrible everything is and pointing fingers at INGOs and international organizations. Talk about something hopeful. And I think some of the stories in your session just now were those kind of hopeful stories of people taking agency and speaking for themselves and really speaking out and saying, stop instrumentalizing us as refugees or as and people in crisis, and stop talking about us in that way. And so to your question, to go back, I think I also go to a lot of conferences, and I think the pitfall is you come out of the conference and you think, okay, now we're going to localize, now we're going to do that. And then you go to the office the next day at 9 a.m. And then the daily grind just starts, and it sucks you in within half an hour, and you go back into your normal routines until you go to the next conference and you say, okay, no, now we're really going to localize. Now we're really going to do something on gender. And so I think this is something that each and every one of us, and I like that agency is in the title of the Congress this year, to think of it as individual agency, not organizational or sector agency, because that way we always just pass it on to someone else will deal with it, right? So to think, what concretely can you as an individual do? And in my role as a director, I'm of course part of those narratives and fundraising appeals and using stories and the whole system. I think Doctors of the World does it quite well, and we're of course changing and have transformed as well as many of our partners have over the years. But there's always still room to improve. So really reflecting on, for example, from your panel, has the individual story that we are telling, is it just because it fits our fundraising materials, or is it truly because we are giving a platform to somebody? Something that I know I and many of my other colleagues will reflect on. Also localization, a topic I think was really unpacked in its complexity here at the sessions. It wasn't just this mantra, let's localize. There was also a lot of discussion on are local organizations able to deal with billions of funding that is suddenly being pushed through? Probably not, right? I mean, it's just the reality from the ground. It's the feedback that we get from our country offices as well, to think through, okay, what does that complexity mean? Instead of just going and saying, we will now continue localizing, and then it never really happens because we don't address those barriers. So I think, embracing that complexity, and I hope every one of you will also go back to the daily grind tomorrow and really try to keep some of the very important messages we've been hearing here today. But back to you. What are you going to do differently? I mean, you've already transformed your work to some extent, as you were saying, but is there something that you take out of the sessions and out of the Congress?
After I answer my emails and try not to go back to the daily grind, I think, it's a journey to transform anything. I'm still learning. I haven't, figured it out. And one of the things that was really hammered home to me by the wonderful panelist I was just speaking with now is something that I think journalists, if you were in the last panel, forgive me because I said this already, but I think it bears saying again, and I think journalists and people in the aid community tend to think that people telling stories is always healing. People who've been through traumatic experiences, that it's always healing, and it's not. I've learned that again and again, and it's good for me to hear that hammered at home, that sometimes it is, for some people in certain circumstances it is, but not all the time. And I always need to keep that in mind. And storytelling fatigue is real. I'm thinking about Lebanon right now. People, if you work in comms, you may have to go up to people and ask them their story really quickly about how being displaced has impacted them. That's probably not actually the best time to be putting a microphone in someone's face. I'm also, I think, going to think about, while I've changed the way I think about journalism, I do think, I mentioned displacement, but I think there are other terms and other things that are really important that are happening here that we could probably do a better job of explaining. IHL, I think the average reader probably is a little bit baffled, sometimes me too. But documenting violations, speaking up when things happening, having those in the news. I have a colleague who likes to say that journalism is the first draft of history. And even though I sometimes feel that journalism doesn't maybe have the impact that I would like it to in the actual moment, I think that documentation is important. And also language. That's another thing that I think we can probably do better at. Displacement is the one that I keep harping on about, but civilian casualties, what does that really mean? When you read in a press release or in a story that civilian infrastructure was bombed, what does that mean to the person who actually doesn't have water in their tap, or the woman who needs emergency care, who's trying to give birth and either doesn't have fuel because a petrol station was bombed, or there is no hospital that you can pay for to get to? These are real actions with real consequences, and journalism, and I think probably humanitarianism can do better. And that's something that I should say I can do better at. So I'm going to take that back with me. Again, after I clear my emails. So if you've emailed me, I'm sorry. So now you're in this humanitarian world again, but you've also worked in government, which I think, tends to see probably the humanitarian space as a little bit idealistic, a little bit do-gooder. I've been accused of being that. How do you feel coming out of these 2 days? Do you feel like it's just ideals? Do you feel like there's real concrete action here?
Yeah, I'm no longer in government for a very good reason, and I'm here for a very intentional reason, so maybe that's part of the answer. Yes, there's definitely a perception, I think, in many places, whether it's government or private sector, that, the civil society, NGO space, especially humanitarian space, is pie in the sky. We're not really realistic about what's possible and what the constraints are, and I mean, we heard on the last panel here in this room as well. I caught the last couple of minutes. You know, it's somebody else's ministry's problem, not really ours. And yeah, that is definitely true. On the other hand, I mean, being here in Germany, I do have to call out the government in a good way as well, because I've worked in the NGO space before. There has been a very good relationship over very many decades, and there has been a great collaboration as well. I mean, government usually taps into NGOs and including humanitarian NGOs, whether it was during the Ebola, definitely was with many of the organizations. I remember MSF was there on the phone like weekly with the chancellor, whether it was preparing for, you know, a G20 presidency. While I was at an NGO, they would be like, please, we need help. Like, what do we do with health systems? Like, how do we reach the most vulnerable populations? Can you give us a list of the countries you are seeing the biggest weaknesses in, so that we can take that into the declaration? So that will was there, and it is still in part there. It is shifting, though, because the government is shifting, and I've mentioned this a few times over the last days, but if you look at the most recent German polls, for the first time, I think it was on Sunday, the far right-wing party has now taken nationally the highest place. So if there would be election today in Germany, we would have a far-right government that does not support anything idealistic, but even sees it, as many of the panels have talked about over the days, as something dangerous, as something bad, as something to be, completely dismantled. And so I think that's an important point that we need to keep making. For me, the humanitarian work is, it's not even a question of whether it's idealistic. I mean, we've got ideals in the Congress title. It is essential for human rights, right? And all of the declarations that all of us should reread to really remember what they are about. It's essential for all of, you know, humanitarian protection and protection of people in crises. And it's also essential for humanity and how we are going to be documented, you said, in journalism as a draft, and in history. How is history going to judge us? And I think the alternative to think of these big, you know, humanitarian, humanity, human rights words, the alternative term, which I think works very well in English, it doesn't really translate into German, is dehumanization. It's something that is very real. It is happening. We're seeing it in our national programs. We're all definitely seeing it internationally. You mentioned Gaza and many other crises. That is the alternative. And I think if we can get that message across more clearly, it's not about some nice to have WASH programs or vaccinations and things that might be life-saving. This is really about, do we treat people as human beings everywhere? And for me, that is not idealistic. It's really existential. Yeah, but back at you. How do you feel about our sector? You also mentioned, and kudos for you know, sharing the vulnerability and your personal story of having this existential crisis of being here. But do you feel it is still idealistic when you hear our discussions? Is it a good thing? Is it a bad thing?
Yeah, I don't think having ideals is definitely a good thing. I think finding ways to make them work is also a good thing. You mentioned dehumanization, and I was struck by something in an earlier panel that Professor Sultan Barakat said about the sort of changing norms about who's a human and who's not, which sort of extends to who can be a target, who's a civilian, who's not. Of course, this matters for journalists, but it also, I mean, if I go back to my own, as you called it, existential crisis, I think about, I was in Beirut in October, and that project I mentioned had been published, and there was a ceasefire, but a lot of people still couldn't return to the south because actually the bombing was still happening, and many homes were destroyed. We're in the same situation again. And in October, I had the honor of being at a play that was actually made of this piece, The Lebanon Displacement Diaries. It's an Arabic language play that told the stories of these 10 people, but it also involved audience participation of them telling, people in the audience telling their stories of what had happened to them during the war. And it was 2 nights, completely full, and I was left feeling that this is the most powerful experience of my career, that we ran out of tissues. And people really felt like they needed to talk about this. It was something that they hadn't been able to share. There's a lot of reasons politically that it's uncomfortable to talk about, but also it's not easy to talk about hard things you've gone through, but sometimes it's better when you're with other people who've been through something similar. And I'm not a very big crier, but I was using the tissues too, and some of the people whose stories were in the original piece of reporting also came, and it made me think about how we think about I don't know, people who receive aid or people who are in journalism. That should be an ongoing conversation, but it also made me think that maybe journalism in the traditional sense is not going to, as I said, stop atrocities right away, but I do feel that maybe we can, with some maybe creativity, some innovation, which I think there is a lot of going on in this sector, we can maybe chip away at this dehumanization, because dehumanization from politicians, from governments, from individuals is eventually what does allow neighbor to turn on neighbor, as has happened in the past. It allows, as you can probably tell, I'm American, it allows political rhetoric that speaks of groups of people in disturbing language and passes discriminatory laws, and you have people getting arrested on the streets, and it also allows governments to commit severe atrocities with no repercussions. So while I'm honestly horrified still at a lot of things that are happening in the world, and I've been pretty devastated the last few months, I do think that chipping away little by little at dehumanization, that might be idealistic, and probably a lot of your work also sometimes feel like you're chipping away little by little because you can't change the whole system. I do think that matters. That's what I've come around to, and it is nice to hear people who are working on the ground who, I know you may not always feel like your program is doing, or your role is making that big of a difference, but the chipping away makes a difference. So that's what I've come to.
Thanks, Annie. And I think that's a good closing to say your work matters. We are all collectively chipping away, and do keep talking to each other, because I think many of us are thinking about these things, and there are creative solutions that are not just relying on things like social media and different ways forward. I have the honor to close, but before I do, I'm going to thank a couple of people and a couple of organizations. So first of all, I would like to thank you. It's been an honor to get to listen and spend 2 days, I think, for both of us, but I'm speaking for all of us. Thank you to everybody who has been sitting here in person, online, who has been on the panel, who's been chatting in between the breaks. It's really valuable to have these conversations and to be able to share together. I would like to thank all of the organizers. There are hundreds of people who have been working for months and months, and also people in the back working on the tech, on audio, on the live stream, clearing away our coffee cups and all that. So I would like us to give a big round of applause for those people too. Thank you. There is a steering committee of organizations who runs the Congress. Doctors of the World has been part of the founding organizations. Do continue to support our work as well, because that enables us to make this conference happen. I'd especially like to thank the New Humanitarian and Oxfam Germany, who have joined us this year. So stay on board, and thank you. A huge special individual thanks goes to Fabian. I cannot see him, but he is in the room. in the back, and also to his colleague Marie, who I hope is also in the room. Great. This conference would not have happened without the two of you. I know you have invested, all of your daily grind time, so we really appreciate it and see it. Thank you to the Silent Green Crematorium, as I heard, as it was before. So yes, you were literally in that room also with the
I'm glad I didn't know that before.
What a lovely, positive space they have made out of it, and maybe it's also a bit of a symbolic call to action for us, working in these ashes that we usually do, especially in all these crises, to kind of think of how do we create this space out of where we are and where it always looks so dire. And also thanks to Mars, who have provided all of our catering and done a great job, I think, at least I see that way. We will continue with the Congress next year, so don't forget to do all of that work in between, but continue to follow all of our channels and the website, and stay tuned. I hope you'll be back next year, and hereby closed. Thank you.